Recording in progress.
Good morning, honorable members and the parliamentary staff, including our guests that have joined. Good morning, all of you. Can we start our meeting by having a silent prayer or meditation? Thank you very much, honorable members. Let me again greet you, members of the Portfolio Committee on Health, the representatives of the National Department of Health, our parliamentary staff as led by the Committee Secretary, Ms. Vuyokazi Machalamba, our honored guests from various entities as led by their board chairpersons, South Africans that may be interested to follow our meeting today. Good morning, all of you. Today, we are on our second day as the Portfolio Committee to conduct our business of doing our oversight over the department and the entities that are under the department. This is our second day. We are meeting with 3 entities today. Yesterday was a very long day. Today it will be better. According to the plan, we are starting now at 10 and maybe up to 4 o'clock. I welcome you all to this meeting today. There is an agenda in front of us, which Ms. Machalamba must start flighting. Over to you, Ms. Machalamba, to flight the agenda. Yes, thank you, Ms. Machalamba. I think the agenda is as follows: opening remarks and welcoming, 2, attendance confirmation of the committee members and apologies, presentation by South African Health Products Regulatory Authority, SAHPRA. Then we have discussions followed by the presentation by the South African Medical Research Council on its annual report. We engage. Then we have lunch, presentation by Mines and Works Compensation Fund on its annual report. We discuss, and then the closing remarks. That's the agenda in front of us as flighted. Honorable members, I give it to you to comment on the agenda.
Ms. Clark and Ms. Shabangu's hands are up, Chair. Thank you.
Noted, Ms. Majalamba. Ms. Clark, I give you the platform.
Thank you, Chairperson. I think it is important for you just to advise the committee that you have been ATC'd in terms of being the interim chair at the moment. So it's just so that the committee know that, so that we do not have to do an election every time we have a committee meeting. Thank you.
Thank you very much, Honorable Clerk, on that proposal. Ms. Shabangu, before I give it to Ms. Majalamba to put the committee into confidence on what was raised, Ms. Shabangu.
Thank you, Chair, and greetings to yourselves and other members. I'm here to propose the adoption of the agenda. Thank you.
Thank you, Ms. Shabangu. But I think it will be good if I can start with what was raised by Honorable Clerk, so that we do things right from the start. That's what I learned when I was doing project management, that you must do things right at the first time. Honorable Ms. Majalamba, the committee secretary, can you come and take the committee into confidence on what was suggested by Honorable Clerk? Over to you, Ms. Majalamba.
Good morning, members, colleagues, department and SAHPRA. Yes, Ms. Clark is correct. You were published on the ATC yesterday that you are the acting chairperson of the Portfolio Committee on Health as from the 7th of October, which was yesterday. So that means that we don't have to elect an acting chairperson every time the committee meets. So you will be the acting chairperson up until we have a permanent chairperson. Thank you, Chair.
Thank you for that clarity, Ms. Majalamba. I don't think Honorable Clark was the only representing herself when seeking clarity. She wanted to make sure that we do things right. I think that has been clarified now. I can go back if everyone is okay with the response. I think we can go back to what I was asking for previously, to say any comments on the agenda. I give it to you, Honorable Shabangu. You were on the platform. I disturbed you myself.
No stress, Honorable Chair. I think you were right, because Honorable Clark had raised what she raised, and I think it was important that it was addressed first. But my hand was up to actually propose for the adoption of the agenda. Thank you so much.
Noted, Honorable Shabangu. Who else would want to second or have a counter proposal on what has been raised by Honorable Shabangu on the approval of the agenda as proposed? We note hands.
Ms. Kumalo's hand is up, Chair.
Ms. Kumalo, the platform is yours.
Thank you very much, Chairperson. Greetings to your good self and honorable members of the Health Committee and our officials. Chairperson, I move for the secondment of the adoption of this agenda. Thank you.
Noted, Honorable Juliet Khumalo, honorable members, our parliamentary staff, our honored guests, and also the members of the public following us this morning. Let me take again the opportunity to welcome you today to this portfolio committee. We are doing our constitutional mandate as members of parliament to do oversight. We are here today to start engaging the three entities that we planned to meet today. And I think I have to give over to Ms. Majalamba, the committee secretary, to take us into confidence on who has joined us today as members of the portfolio committee who are connected today for us to establish the quorum. Ms. Majalamba, over to you.
Thank you, Chair. Present is Ms. Theko, Ms. Shabangu, Ms. Khumalo, Ms. Clark, Dr. Leroux, Mr. Mutubatsi, and Mr. Van Staden. I have received an apology from Ms. Sene. Thank you, Chair.
Thank you very much, Committee Secretary. Those are who we are today. And according to the rules, we make the required quorum for us to carry with our business as planned. Let me also say something on the virtual meeting rules, wherein as the members of the portfolio committee, we have to be connected to the meeting right through the day. And also we have to mute ourselves up until we are recognized to speak. We have to unmask ourselves so that the public and also us in the meeting can be able to see who is speaking, unless there is a challenge, a connectivity challenge for you to do that. You are also, you can, as a member, if it's impossible for you to unmask yourself, just inform us about that predicament so that we know that you understand that you were to be seen by us in the meeting and also the public. Do inform us about that, as I have done. You see me, I am this person that is talking now. I may switch off my video because I want to be audible right through the meeting. Also, those that are going to lead presentations must make sure that they have been given sharing rights. All what they encounter as a challenge, they must be able to speak to our committee secretary offline so that any predicament that may be there is solved. When we expect them to start, they start with the presentation. I think the first entity that we are to engage is the South African Health Products Regulatory Authority, that is SAHPRA. Welcome, SAHPRA, if you are already connected. I think so. Good morning to the board chair, if there, and members of the board, and the CEO, all who are here representing that entity. You are welcome to the portfolio committee. We are giving you not more than 45 minutes, but we will see if you finish within that time. We are a committee that has already got your presentation. What we are interested in as members of the portfolio committee is to engage you on your annual report. That's our way, one of our ways to do oversight over that entity that you coming from. Over to whoever is going to start so that at the end we get your presentation. Over to you. Thank you.
Thank you, Chairperson. My name is Tapelo Mutsudi. I'm the chairperson of SAHPRA. I've got a few of my board members here as well, and some of the executives who are going to be leading the presentation on the behalf of the entity. Some of the board members could not attend due to prior engagements, but I think we've got enough to be representative of us as an organization. I've switched on my camera, so I'm hoping that you can see me, because I can't see myself on the device that I'm using.
Yes, we see you. You can switch off your video so that your connectivity is clear right through and you are audible right through your presentation. Thank you.
Wonderful. So thank you so much, Chairperson, for the opportunity, and I'd like to extend greetings as well to the other members of the committee who are here, and I imagine that there might be some other external parties who are part of these proceedings as well. We are quite a new board. We were only appointed recently on the 1st of July, 2025. So we're still trying to find our feet within the organization, and I've only held one official board meeting. So
Can I interrupt you just to ask if you are the board chairperson or a member of the board? I did not get you well when you were starting.
I'm the chairperson.
Thank you very much.
Thanks. So yeah, so like as I was saying, we were fairly new. Therefore, the performance that we are presenting today, it's really on behalf of the previous board. We have done quite a stellar job, as I'm sure you've had an opportunity to see the presentation that we've submitted to you. So, obviously, if they hadn't done a great job and the performance was poor, we would have blamed them. But we'll try and take the credit as much as we possibly can for all the great work that they've done over the preceding few years. And I think I need to spend a bit of time acknowledging the role of the previous board, because it's really quite impressive how much they achieved under trying circumstances. For those who might not be aware, SAHPRA is quite a new entity itself, only a few years old. And, the previous boards have had to deal with multiple challenges, starting with essentially starting the organization from the ground up by transferring staff from the Department of Health into the new SOE. They had to expand their mandate from the former Medicines Control Council to start regulating radiation-emitting devices. They had to develop regulations for complementary medicines and medical devices, all of which continue to be challenges that the organization is grappling with. And then, of course, they had to respond to the judgment on cannabis that we're all familiar with from the Constitutional Court a few years ago. And as if that was not enough, they had to deal with a global pandemic in the form of COVID-19. And I think it's quite commendable that with the executive team that we have in place and the stellar leadership of Ellen Rees, the board managed to keep it all together, culminating in the entity that we have today, which is very different to how things were when the organization started. So I think I speak on behalf of the board, the new board, when I say we're very grateful for all that they've done. But now we have to deal with our own challenges as a new entity. It's a new world. New dynamics have come into play. And we have to not only navigate the current challenges that are facing us, but imprint our own legacy on the organization before we leave it in the hands of the group that's coming next. And one of the main key things that we face as a challenge, Chairperson, is the legitimacy, crisis of legitimacy. Regulators globally are being challenged because of I suppose, COVID, the after effects of COVID, where there was doubt about some of the interventions that were proposed by the regulators and public officials globally. And all those interventions, of course, were driven by science, and people sometimes don't appreciate that the very nature of science is that when new information comes in, you adapt and you change the advice that you give. But sometimes the public sees that as a weakness, as uncertainty, as not knowing what you're doing, when in fact it's strength to adapt and change protocols and guidelines as new information, as science improves and new data is analyzed. But there is a crisis of legitimacy. We are aware of the things that are happening in the United States and some of the claims that have been made about autism, about COVID vaccines, a lot of which are not based in any science. So,
Chair,
hello?
Chairperson, I'm
Miss
sorry.
Honorable Shabangu, yes.
Yes, Chair. I don't know, I might be missing something. If the chairperson from the board is presenting because without anything on the screen, or is still doing some kind of introduction, I'm sorry to disturb him.
Thank you, Honorable Shabangu. I thought as such that the board chair will end up presenting somebody who's going to lead the presentation. I think these are just his remarks as the chair. Am I correct to suggest that Mr. Tapelo Muchuti?
You're very correct.
Okay, you can continue.
Yeah, I might probably be overly laborious. Maybe that's why the honorable member is asking the question, but I'm just framing the discussion that's going to ensue in our role as a board, given that we are a new entity engaging with the committee for the very first time. So I just thought it might be worthwhile for me to give you the headspace of the current board, what we envision should be the future should look like, given the current challenges. But I'll be quite brief and then hand over to the executive to do the presentation with your permission, Chairperson. So as I was saying, one of the key challenges that we face is the legitimacy of regulators globally, which we need to respond to effectively. There's artificial intelligence and its use in medical devices. We need to respond to that effectively as a new board and the organization in how we're going to regulate all these different software packages that are being introduced and the extent to which we'll be able to regulate those new tools will be a reflection, I suppose, on the agility of the regulator to adapt itself to a changing world. We have an opportunity as a new board to engage our customers again, and our customers obviously will be our political principals, it will be the industry, it will be the public, and get a sense of what they imagine the regulator should do and the role that we should serve in South Africa. There's been a raging debate that's been ongoing in the country right now about BEE and its legitimacy and whether it should be in place or not. As a regulator in South Africa, we have to respond to those discussions as well and how we regulate new entrants into the market that has been dominated historically by big pharmaceutical companies. So, Chairperson, I'll stop there in the interest of time, but I just needed to frame how we see ourselves as a board and the challenges that we face going forward, and the extent to which we should be able to respond to them. And lastly, I would also need to highlight to the committee that we have a CEO who's serving her last term as a CEO. She's still only 1 year into it, but as a board, we'll need to start planning for a new change in leadership going forward into the future. So I'll stop there and hand over to the CEO and her team to then present to you the formal presentation from the entity. Thank you.
Over to you, CEO.
Thank you, Chair. Good morning, honorable members, and thank you for the opportunity for SAHPRA to share its annual report from the last financial year. I'm going to just to mention that as the board chair indicated, we do have our executive team that have also joined this meeting, and in the presentation I will be co-presenting with our CFO, who will cover the financial aspects. I'm going to switch off my camera now so that I can share my screen and not be affected by any bandwidth.
You are allowed. You can continue.
I trust you are able to see my presentation. It seems as so from my side.
Yes, you may start presenting. We see it, Ms. Tumi.
Thank you very much. Again, thank you, members. So, and thank you for the 45 minutes that you have provided us. We're most likely going to utilize them because we thought we'll take you through a bit of operational context in addition to what the board chair has shared regarding to where we are, what are we grappling with. And then secondly, I'll share on our performance outcomes for the previous financial year, and we'll go into a bit of deep dive on our finances, and then we will conclude. Just to highlight what our mission is as a regulatory authority in South Africa, being the regulatory authority that oversees all health products, which means that any product that makes a medicinal claim, it has to be regulated by SAHPRA, and the entity that is providing that product or manufacturing that product must be regulated by SAHPRA. And for us to be able to do so, we have a vision that we need to be agile and responsive as an African regulator, and that we need to ensure that we are globally recognized. You will note in the later slides in the presentation where I speak to this, but really at the core of it is that we are an enabler to access to safe, effective, and quality health products. This is one aspect that we always guard jealously, Chair, that whatever products that are available in country, we must be able to say they are safe, effective, and are quality products. And if they're not, we need to act. Our mission is to promote access to health products and protect human and animal health in South Africa through making science-based regulatory decisions. And so all our decisions are based on scientific data that is made available to us, that we review as a regulator together with our technical experts. If we're not satisfied that there's adequate scientific data to enable us to make a regulatory decision, we then would not be able to. Our values are Ubuntu, responsiveness, integrity, transparency, efficiency, and excellence. And while we're still battling in some of these areas, this is our aspiration that we will be able to model and demonstrate these values. Just briefly to indicate that our mandate, as I've mentioned just now, is to ensure the safety, efficacy, and quality of medicines and the performance of medical devices, diagnostics, and radiation emitting devices, and all other related products. And we operate under the Department of Health. I have, and I cannot stress this enough, that ours is to monitor all health products, to evaluate them, to investigate the facilities that manufacture these products or wholesale these products, to investigate them, and when we are satisfied, to issue a registration. We do this for health products as well as scheduled substances. So you will find that some scheduled substances such as tetrahydrocannabinol that you find in cannabis, it is a scheduled product that would be regulated by SAHPRA, particularly when it's used for medicinal use. We also regulate clinical trials, so all studies conducted in the country to evaluate medical devices or medicines have to undergo a rigorous review by SAHPRA before they can be authorized. There are 2 acts, Chair, that govern what it is that we do. We call these our Bibles. It is the Medicines and Related Substances Act of 1965, and the last amendment was in 2017. We are busy at the moment with the overhaul of this act because it's had many numerous amendments over the years, and we were advised that we need to put in place a new act. So we're busy working on the SAHPRA bill. with the Department of Health. And as soon as we have the bill ready to be tabled with yourself, that process will start. And within the Medicines Act, ours is to ensure effective, efficient, and ethical assessment and regulation of all health products. Ours is to ensure that all our processes are transparent, that they're fair, objective, and that they're timeless. There's also a recognition within the Act that we cannot operate in silos, and so it enables us to cooperate with other regulatory authorities and stakeholders. As Dr. Tapelo Mutsudi has said, when SAHPRA was established from the previous MCC, one of the areas that was included in our mandate is radiation control. And so the Hazardous Substances Act, Act 15 of 1975, is also within the ambit of SAHPRA. And it largely is to regulate those medical products that emit radiation material. While we comply with those two very important pieces of legislation, ours is to also ensure that we're compliant with the Constitution of the country, with the National Health Act, and many other related legislations that impact our work. I'll make an example maybe with the Foodstuffs and Cosmetics and Disinfectant Act, wherein if there's a cosmetic brought into the country or manufactured that doesn't make medicinal claims, it would be regulated under the Foodstuffs and Cosmetics and Disinfectant Act. However, the minute it contains a scheduled substance or it makes medicinal claims, then it's registered under the Medicines Act. Another important act that we've been engaging with quite closely, even as we review our act, is the Nursing Act, particularly when it comes to the scope of practice and within the scope of practice, what scheduled products they are or not to prescribe. We also work very closely with the Pharmacy Council, and there are pharmacies that are licensed both under the Pharmacy Act as well as under the Medicines Act. So with many of these, Chair, there's very clear lines of collaboration with the entities that oversee all these other acts. As Dr. Mutsudi mentioned, that this is the previous board of SAHPRA, whose term ended in June of 2025. And so they were the board at the time of the reporting period that we're presenting today. These are the current board members that we have as SAHPRA, with Dr. Mutsudi being our chairperson and Prof. Glenda Gray being the vice chairperson, and we have 11 board members at the moment. And they were appointed effective from the 1st of July. This is our executive committee. We have Advocate Mpilo, who's our board secretary, Ms. Lindiwe Mudisakeng, our HR executive, Ms. Kristalna Reineke, our chief operations officer, and I'm the CEO. We have Temi Gopal as our chief regulatory officer and Mr. Rechard Gous. So we do have quite a diverse executive committee. If I could just share with you, Chair, the environment that we're operating within, as it will also give you a sense of just our performance over the years and some of the matters that we're grappling with, and some of those we may even solicit your support as the portfolio committee. So from a regulatory perspective, when one looks at the local context, what we are experiencing is that there's quite a good awareness of SAHPRA, and this is largely post-COVID. I think post-COVID, people got to know that we have a regulatory authority in the country and what our mandate is. And we really work hard to engage the public on matters that are specific to us, just to ensure that we have an even greater awareness. Secondly, a matter that we're grappling with, and we've just recently launched a national action plan. Some of you may have seen our Honorable Minister of Health presenting on various platforms, radio platforms, together with our teams, on the need for us to curb the substandard and falsified products that are causing mayhem in the country and in essence, compromising our health system and presenting a risk of having to lose lives if these products are consumed largely by children. From a health sector perspective, within the South African context, we're seeing that while we have a limited number of local manufacturers, we have quite a number of them coming to us and indicate their intention to manufacture locally and soliciting advice and support for SAHPRA. We also continuously engage with the National Department of Health around the NHI. From an African context, we continue to work with the Africa CDC to say how we can support countries, and in this case, our country, wherever there is a threat for an epidemic or pandemic. But also being one of the strong regulators on the continent, there are instances where SAHPRA is called on to assist other regulatory authorities on the continent to enable them to respond to either an epidemic in the country. We also have over the years built very strong collaborations within the continent. A matter that is still pending and remains to be quite important is around the ratification of the AMA Treaty, which has not been ratified by South Africa. We are getting many questions around why that is so. Are there fundamental challenges that the country has with this treaty? But we've tried our utmost, Chair, to give confidence to our colleagues on the continent that this is certainly not the case. It is undergoing our various processes. It is now with the state law attorneys. From an African continent, again, I made mention to us being ready for any threat of epidemics or pandemics. The most recent that we dealt with was Mpox, which was designated as a public health emergency of international concern. That status is no longer the case at an international level, but at a continental level, the Africa CDC continues to have it as a public health emergency of continental concern. We've all noted the impact of the pulling of the US government support to a number of programs. Again, we've seen this across the continent, even in some of the regulatory collaborative areas that we're working with other entities on. At a global level, I must say a lot of us on the continent, including ourselves, are getting great support from the WHO, from the European Medicine Agency and other regulators, particularly with the US government funding having reduced, that we are seeing that other entities are certainly offering their assistance. As we continue, I just want to come then more internally within SAHPRA. That was the external context. Within SAHPRA, one of the quite important areas that we are busy with at the moment is a digital transformation. This is to enable SAHPRA as it undergoes change to ensure that it builds sustainability going forward. And so we recognize the benefit of digital tools. We also have put in place some proof of concepts for the use of AI in our processes so that we can drive efficiency. So we do have some of our processes, such as Section 21, new registration amendments and renewals that we have completely digitized. I must say we are having some teething problems with this platform. Some of the members may have had those in industry maybe call you and complain that we've had downtime at times, but please rest assured that we're working on this as speedily as we possibly can to ensure that our operations are stable. So we embarked on this. We went live with these tools in April of this calendar year. Secondly, as I've mentioned earlier, we are very active participants in continental platforms such as the African Medicines Agency under the AU that has now been established. A DG has been appointed. And really what this agency is going to do is that it will be a continental regulator. In essence, industry would be able to submit their applications to AMA. AMA would then make a recommendation that then the 55 member states can then recognize and be able to register products within, say, 90 days post an AMA review. Hence, it is important that South Africa participates in this so that we would be able to recognize work conducted by AMA. But also, AMA is soliciting South Africa's participation. As I mentioned, we're one of the very strong regulators on the continent, which means they do need our technical assistance, the assistance of our assessors for the review of some of the products. There's also a SADC platform that we have with a similar mechanism called Zazibona, and we've been active participants through that. Again, it enables a submission within the platform at a regional level, being SADC, and then when the applications come to SAHPRA directly, we then review those within a 90-day period because we would rely on the work that we've done within Zazibona. And while these great things are happening at a continental level, we must indicate that we remain to be under-resourced as a regulator, and hence, we do need to rely on these other mechanisms where they present a mechanism for collaborative review, and we can then rely on that because from a HR perspective, we certainly are understaffed. We underwent a staff survey, and we have implemented about 70% of the recommendations. And one of the complaints we get from staff, hence I mentioned the issue of being understaffed, is that they are overworked. But also you can imagine that with the importance of the work that we do, we have to ensure that we are efficient. We have to ensure that the public accesses these health products that are within our pipeline and needs to be finalized. So there is indeed a lot of pressure on us as an authority to be effective, to issue regulatory decisions timeously. However, this issue of being understaffed is certainly putting pressure on our staff. However, we are trying our utmost to make sure that we address any gaps. As we continue with the organizational environment, one of the things that we have put in place, and it's improved now this financial year, was the collection of retention fees. But we're seeing a big improvement in this current financial year. So what this means is that everyone who is licensed by SAHPRA annually, they need to pay a fee for that license to be retained. What we are also seeing is that with the increase in the diversity of health products, the board chair mentioned AI as a medical device earlier, we need to ensure that we have the right skills to be able to regulate these areas, and not just have the right skills, but have them in the right quantities that we require. So we've implemented a number of mechanisms. We've got at a point community service pharmacists. We've now implemented an internship program together with the South African Medical Research Council. We also have appointed individuals on, say, 3 or 5 year contract when we have been able to raise funding from external sources, because our current finances are not enabling us to fill our vacancies at the rate that we would prefer. The allocation to SAHPRA continues to reduce over the years, and we are generating fees. However, it is not adequate. Just to move to partnerships, I mentioned earlier that the Act also enables us to collaborate with others, and this is of utmost importance, Chair, for us. Even with the National Action Plan that we launched last year with the support of the Ministry of Health, there's a range of stakeholders that are working with us, the South African Police Services, the NPA, the Pharmacy Council, because there's an appreciation and an understanding that SAHPRA needs to then work with other law enforcement agencies. It needs to work with other regulatory bodies in the country. So we had undergone quite a significant process of ensuring that there are MOUs that guide these partnerships. For example, with the Council for Medical Schemes, we've entered into an MOU with them because there are instances where they need data from us. We also have MOUs with other regulatory authorities on the continent. And then I'm going to shift gears, Chair, and then after that context, share some performance of the last financial year. So we had about 24 targets at an APP level, strategic level, and we delivered and we achieved and exceeded about 87% of those. I'm going to briefly move through these slides as I take them as read because I've provided quite a bit of context. The CFO will go into a bit of detail on the finances in terms of the revenue that we had over the prior year and how it varied from what we had budgeted. I've spoken about from a IT perspective that we are implementing our regulatory information management system, which is really our digital overhaul. Communications, I've alluded to this also in terms of the need for us to constantly be engaging with the public. We had a lot of campaigns last year, webinars, and a lot of these were focused on promoting medicine safety, urging the public to report to us any adverse drug reactions. We also have a structured mechanism of how we engage with industry. We meet with them quarterly to ensure that we disseminate information of any changes within the regulator. But also we participated in many national, regional, and global fora. From a human resource perspective, this is one of our areas that we're focusing a lot of late, especially post conducting that survey, Chair, because there's a lot of feedback that we got from staff in terms of staff wellness. And so at last financial year, we had LIRA, which was formerly ICAS, that we had for our employee health and wellness program. We also have host wellness days across all our offices. We have offices in Pretoria, Durban, and in Cape Town. And also last year we had our AGM, wherein we recognized the staff for excellence. We had our excellence awards. We also gave long service awards to the staff that were due for those. I'm going to again move very quickly through particularly the targets that we met. Specifically around a clean audit opinion, we did meet it for the prior financial year, which was 23-24. We remain to be a sustainable organization, a going concern, in that our current ratio at the end of the prior financial year was sitting at 1 to 1.27. We've had a stakeholder survey for the public, for industry, and we have implemented some of the findings, the targeted number of findings from that survey. I've alluded to the staff survey also, that we ran the survey and we implemented about 70% of the recommendations from the survey. And, work is ongoing this year. Employee training remains to be an important part of how we operate as a knowledge organization. We need to ensure that our staff are always up to date. And so we invest quite a bit on learning and development initiatives. And so we met that target. In terms of filling the roles, we were able to fill the roles that we had budgeted for the year. As I say, we're always limited by budget availability. And so every year we undergo an exercise where we say, with the limited resources that we have, which positions do we prioritize and can we fill? But we certainly have a lot more positions we can fill. As we speak, Chair, we have a staff complement of close to 350 or so. And our fit for purpose structure indicates that we need to be closer to 500. So we're really doing a lot with the limited resources that we have. The staff turnover, it's not a concern for us, as well below the target of 10%. We are operating in an industry where there's a lot of movement. You will also note from our demographics that we are an organization that has staff that's largely in those age cohorts where they move a lot. So it is expected that people will move, but we try to maintain the turnover below 10%, because if it's higher than that, it certainly will have a negative impact. And we met our target for the enterprise architecture rollout, which is our digital portal. Just in terms of the health product authorization, I made mention to these collaborative platforms that we have at a continental level, but also just to mention that we work with others across the world. There's a product that we evaluated together with Swissmedic under a program that enables collaborative review with other countries. So they invited SAHPRA to that review. We also took part, and we will be communicating a decision quite soon with the European Medicines Agency on the review of lenacapavir under the EU M4All mechanism. So SAHPRA is recognized globally and is invited to these collaborative review platforms. So with that said, we were able to meet our target for registration of new chemical entities. So these are products that are completely new to the country. We also met our target for generic products that were to be finalized within a specific time period. We also managed to maintain our ISO 9001:2015 certification. The one target that we were not able to meet, Chair, is around achieving an ML3 to conduct an ML4 self-assessment for medicines. We are still busy with working on achieving an ML3 for medicines. We moved to the current financial year. We actually have WHO that has confirmed that they will be coming in November to assess us for ML3 for medicines. We are currently ML3 for vaccines. In terms of inspectorate and regulatory compliance, this is one of our busiest areas at SAHPRA at the moment because of everything that's happening around these substandard and falsified products. So what we have at all the ports of entry, the sea ports and the airports, we have SAHPRA staff that review the products that come through there. And if they're non-compliant, they do not let them into the country. And that has helped a lot in blocking any substandard and any falsified products coming into the country. We also are seeing a proliferation, again, of these products that are illicit or illegal, such as the GLP-1. So that's the glucagon-like peptide, which is indicated for diabetes. But one of the side effects is weight loss. And only recently has it been registered for weight loss in other countries. We've received data that we're busy reviewing for a weight loss indication in the country. But we're seeing a proliferation of these illicit products, some that are being sold on e-commerce platforms that are not regulated. So this is an area that's certainly keeping us quite busy. But we continue to work with the other authorities to assist us in curbing these substandard and falsified products. So within the inspectorate area, one of our functions, as I mentioned, is to go out and inspect facilities that manufacture or are warehouses for these products. We had a target to have 60% of those being finalized within 125 working days. I must say we missed this target and we're battling with resources in this area. We are under-resourced, but also even when we try to fill the roles, it's a skill that's not easily available in country. If it's available, the people are working in industry, getting much higher salaries to what we would be paying. So it's very difficult to attract individuals into this area. But Chair, we have put in place mechanisms to see how we can ensure that we meet this target in the current financial year. Permits, we have met and exceeded that target. These are permits that we issue for import and export. And in terms of regulatory compliance investigations, so whenever there's a matter that's reported to us, how quickly we then go out and we investigate and we finalize so that we were able to meet that target. And then if I can move to clinical and pharmaceutical evaluation, within this area, that's where we have the Section 21 area that we've also digitized. We did have teething areas in the beginning, had many complaints from the healthcare professionals, but this has subsequently settled. And again, the pharmacovigilance area sits within here, so we do a lot of webinars with the public. We had a Med Safety App Week that took place last year in November, where we were quite active. We engage with the public, we have webinars, etc. So within this area, we met our target for the time we take to issue these Section 21 authorizations. We met our target in terms of the time we take to review and finalize applications for clinical trials. We met our target for the time we take to review product health safety signals, and also our target for the awareness campaigns. Lastly, we also met our target for the lot release function. So what this means is that when a vaccine is manufactured in country or imported, before it goes into the value chain, the distribution value chain, it has to be tested for its potency and efficacy. And so here we've met our targets, a very important function. And I must mention that we are a WHO reference lab for conducting these tests. The last program being medical devices and radiation control. This is an area that's progressing quite well. We do need to increase capacity. We've had a number of staff members retire within this area. And so we are busy with the recruitment and filling some of these roles, but also we engage quite a lot with a range of stakeholders within this area. For this area, we met the target for the time we take to issue medical device licenses. One target we didn't meet here is around issuance of a collab notice for the high-risk products. And so what we had done was to implement a feasibility study, which we're finalizing this year, and we'll also be conducting a CS for the regulations. And the CS has led to a delay in being able to issue a collab notice. However, the other targets around the time we take to issue radionuclide licenses, we do meet that. The time we take for listed electronic product licenses, we also meet that. And then in terms of our staff profile, Chair, as I've mentioned, quite a young organization in terms of age profile, but also quite diverse, wherein we have a good representation of Black African employees, which represent about 81% of the staff at the end of that financial year. We have about 3.9% of the staff being Indian employees, and white employees accounting for 6.3% of the staff. I'm going to move quickly in the interest of time. I'm now going to hand over to the CFO to present these slides.
Thank you, CEO, and good morning. This table just presents the audit outcomes for the past 6 years. We had a bit of a rough start in 2019-20 and 2021 with qualifications, but gradually working around those areas of concern with our audit action plans, resulting in our first clean audit in 23-24, and then we maintained our clean audit again for this annual report for the 24-25 financial year. Also, no irregular, fruitless, and wasteful expenditure reported. Next slide. This is just our performance outcomes for the past 6 years as well, where we've seen our best performance to date for 24-25 at 87%. Next slide. Just to the finance slides, thank you. The table or the graph here presents basically our growth in own fee income that SAHPRA is being able to generate versus our government grant that we receive per annum and a bit of our interest revenue that we generate. But you'll see basically our own fee income increased from 169 million in 21-22 to about 255 million in 24-25. This year-on-year increase over the past 2 years have slowed down a bit to about 10% per annum or 24 million year-on-year. But we do anticipate that around about 10% growth rates over the INCTEF period due to the revised fee regulation, a significantly revised fee regulation that was gazetted in February 2025. We did have a grant reduction in 23-24 of about 10%, and that's about 15 million per annum, which had a bit of impact, but fortunately our own revenue growth have been able, or we were able to sustain that cut in with our own fee revenue that we generate. But overall, our own fee income generation is quite important for SAHPRA to remain sustainable and to grow the organization and fill unfunded vacancies, historically unfunded vacancies going forward. Next slide. We just had some graphs here for our fee income analysis, and the graph on the left-hand side showing fee income versus cost of employment basically indicates with the growth of our own fee income, we have invested that back as much as possible into our cost of employment, with seeing our cost of employment increasing from 191 million to 277 million in 24-25 for the budgeted for vacancies that we could afford. Then we just the graph on the right-hand side showing fee income versus our transfer or government grant. And we've seen for the 21-22 financial year, the first time our own fee income generation exceeds our grant income, and that has grown then steadily over the financial years. Next slide. This graph shows our revenue versus expenditure, or our income statement or statement of financial performance over the past 4 years. And we were able to maintain accounting surplus mainly due to more than anticipated revenue generation per financial year. We did have some under expenditure in certain areas, but also external funding support. But overall, our financial situation, management assessment has assessed that SAHPRA will continue as a going concern for the foreseeable future. Next slide. Our expenditure per program, just over the past 4 years again. Our program 1 is basically our administrative and operational support program, but that support mainly is for the core business functions for program 2, and which is program 2 to 5. But basically 43% of our expenditure goes into that supporting role. This includes some of our external funding that we've received to support core business units. Program 2 to 5, which is our core business functions, with 57% of our total expenditure going to those programs. And to note, for program 2 to 5, about 90% on average is allocated to cost of employment, with the exception of program 4, which has our National Control Laboratory, so they do have a higher operational expenditure compared to the other programs. But in terms of our overall cost of employment, we've got about 78 positions that were historically not funded, core positions specifically, and it will cost about 68.6 million to fund those positions per annum, which we currently at the moment don't have the funding for. But as the entity grows, as CEO indicate, we do look into this and see how many of those positions we can fund for a specific financial year. And next slide.
Thank you, Rahmat. So Chair, just to conclude, based on what we've shared, we've highlighted that limited resources remain to be a challenge across all our areas. We need what we've done, and it did bear well for us, as you've seen with the progress over the years, that we have very strong governance mechanisms in place in our finance and our supply chain, that we were able to have unqualified and eventually clean audit outcomes. How we also manage our cash and our revenue has enabled us to continue to be a going concern. And the fees that we had in place and were published in February of this year, which was later than usual, but we did engage with the department and the National Treasury that we need to ensure that with the new sets of fees, we need to ensure that they are published timelessly. And we continue to look at digital approaches, not only for our core function, but even for our HR programs. We're using Sage, and even in other functions within SCM, etc., just to ensure that we drive efficiency. So digital transformation is core to our strategy. Thank you, Chair. I'm going to end here.
Thank you, Dr. Mochudi, and also the CEO, and to all those that made a presentation. I think the time we budgeted was enough for you. You were able to finish your presentation within that prescribed time. Thank you very much for that. Now, there comes that time of honorable members to indicate their interest to engage with the presentations. We will, like any other day, note hands as they come. I will be assisted by Ms. Majalamba to identify those hands. Can we start indicating honorable members?
The first one is Ms. Clark, Chair, followed by Mr. Van Staden,
Yes.
followed by Ms. Shabangu,
Yes.
followed by Ms. Chirompungose,
Yes.
followed by Ms. Kumalo,
Yes.
Mr. Mutubatse,
Yes.
Dr. Litlape,
Yes.
and the last one is Dr. Leroux. Thank you, Chair.
Yes. Thank you very much, Vuyo. Let's give you the platform, Honorable Clerk.
Thank you, Chairperson. Just firstly, if you would indulge me, I would just like to also get clarity on two issues. As you well know, we attended the exchange program in the UK in terms of HIV, and I just wanted to find out from SAHPRA how far they are with the lenacapavir approving that in terms of HIV treatment, and also selenium. Why are they declining products with selenium when it is internationally recognized? It's very important that I know that for malnutrition. And I appreciate your indulgence. So I'll ask my questions now. What action has SAHPRA taken regarding the cases referred to them by the Special Investigations Unit? What was the SIU's recommendations and what was the extent of the violations? Then what is the WHO maturity level 3 for medicines? What is the impact of not obtaining this and why was this target not met? Please further explain why the annual report indicates that SAHPRA already has a ML3 ranking. What is the average time currently that it takes to finalize new good manufacturing practice and good warehouse practices relating to licenses? And what is the impact on the businesses waiting for the licenses? And are they able to operate at all? Then please explain the consistent overspending in Program 1, Leadership and Support, by 26.7 million in the year under review and 50.9 million in the previous financial year. What is being done to address that? And finally, medical science and medical authorities are under pressure, especially in the US, from political interference. Is the legislation governing SAHPRA robust enough to prevent political interference in its decisions and its independence? Thank you.
Thank you very much, Honorable Clerk. Honorable Van Staden.
Thank you, Honorable Chairperson. I'm going to just mute my video, my signal strength. Thank you for SAHPRA for the report. It's much appreciated. Only two questions from my side. I understand your memorandum of understanding with the Border Management Authority, but we must remember that the Border Management Authority has got its own constituencies and issues, which I'm not going to reveal here. That's a discussion for the Portfolio Committee of Department of Home Affairs. But there are some budget constraints with the Border Management Authority. Regarding that, somehow some fake medicines still slip through our country's borders. I just want to know, how are you addressing the issue of that fake medicines that slip through our country's borders and is available already within our borders? That's my first question. And my second question, I just want to get an update regarding what is the latest regarding the Mpox vaccines. Thank you, Chairperson.
Noted,
Sanibonani.
Honorable. Yeah, I think it's Honorable Shabangu. Before you, Honorable Shirompongose.
Okay, Sihlalo.
Thank you.
Thank you, Chair, and greetings to yourself again, and thank you for this presentation by SAHPRA. Chair, on this presentation, only 72% of the budgeted posts were filled despite available funds. The CEO in her presentation, she said staff turnover, it's not a concern because it's at 10%. I think, Chair, as a CEO and a good CEO should be concerned about the staff turnover, even if it's at 5%. It should be a concern, because if not a concern, they will never sort any concrete retention strategies, because it's not a concern. Because any staff turnover, it calls for the management to look at the causes and sort out the retention strategies. The fact that it's a competitive industry, it's one of the things, but it cannot lead to the alleged staff turnover that is happening at this department. Chair, there have been allegations of staff turnover in this department, and it's not starting from now. And these allegations, they were reportedly due to ill treatment by the management. Can the CEO take us into confidence, take this committee into confidence, to clarify whether these allegations are credible or not, and the measures that has been taken by this department to address these challenges? Because the allegation is that there is favoritism from the side of the management that leads to staff turnover. The favoritism of a specific skin color and the ill treatment. So it worries me if the CEO says staff turnover is not a concern, whereas there's been these allegations. Furthermore, Chair, I know that SAHPRA is an entity under the Department of Health. We, as the portfolio committee members, we will have to follow up on these matters, both with the department and with SAHPRA, because we cannot be here. There must be an accountability to be upheld. We have to ensure that there's fair and good labor practices in every department where there are employees. So I'm just raising this, Chairperson, because it's an allegation that has been coming out that the staff turnover in this entity is due to ill treatment by the management. So I hope that in response, the CEO will take this committee into confidence to indicate whether these are credible and not credible. But I will request through you, Chairperson, that we follow up on this with the department. There must be an accountability on this, because I mean the statement of staff turnover is not a concern, and that was it. It really worried me based on these allegations. Thank you, Chair.
Thank you, Honorable Shabangu. It's your turn now, Honorable Shirompungose.
Ngiyabonga Sihlalo, greetings to yourself, colleagues, staff members, and greetings to SAHPRA as well. Thank you so much for the presentation, Yenu, and I think it's important to outline that we welcome the audit outcomes in relation to SAHPRA from the AG. We commend them and hope that it will be the case as you have sustained it. But I think, Sihlalo, in relation to other deeper questions or deeper operational issues, there's three main issues that I'd like SAHPRA to appraise us on, right? Firstly, I saw that on the 6th of October, I don't know how true these reports were, is that SAHPRA experienced a temporary outage due to technical issues, and that it has an impact on accessing regulatory information, application portals, and updates for stakeholders, amongst others. And I want to find out what the issue is there and the prevention mechanism going forth, because I think this is a big part of SAHPRA's operational means, especially in relation to just ordinary people trying to access their services and to find out vital information. And then secondly, on financial and resource constraints in relation to backlog in approvals. I just want to find out what the resource limitation is and how it contributes to delays in processing medicine registrations and clinical trial approvals. And I'm asking this, Sihlalo, because there is a consistent complaint in regards to SAHPRA, especially from Black people, in relation to approval and processing of indigenous medicines, right? It's as if SAHPRA is only focused on Western medications. I don't know, because there's a superiority complex in regards to that, but we're Africans in Africa, and not just with Black people, with the Chinese, with the Indians, who also have their indigenous ways and indigenous medicines, that SAHPRA needs to start taking as seriously as they do Westernized medications. So I just want to find out what the situation is there and the capacity. Does SAHPRA have the capacity to process indigenous medicine applications? Because there was a time not too long ago when I was trying to reach out to SAHPRA, because there is a practitioner that was having an issue for the past years, 4 to 5 years, in the application process of SAHPRA, and to date, that's still the case, right? So please, even after this, can we just get in contact, CEO? I will send you a message. I did ask for your contact details to be able to find out what the situation is and how SAHPRA can be able to assist. And then lastly, on cannabis and hemp regulation, right? On regulatory and compliance issues. We saw that there was a special economic zone that was launched by the government in the Eastern Cape not too long ago, estimated at 1 billion. And there's been a lot of scams that have come up in relation to that. I want to find out what the view of SAHPRA is and how their regulatory process is able, or if they have jurisdiction over that industry. There's many people who've been victim to scams that have been tied even to those companies that are tied or have operational access or relationship with government itself. I don't want to mention them by name, but I want to know how far SAHPRA has gone following the regulation change on hemp and cannabis, and the special economic zones being spearheaded by government, obviously outsourcing vital operations to the private sector. I want to find out how SAHPRA is operating in that industry. And in relation to counterfeit medicines, there's a rise in substandard and falsified medicines, particularly in the private sector. And this poses a serious and significant challenge. Is SAHPRA's enforcement capacity exhausted? And how does this risk public health? Because this then impacts our trust in SAHPRA, it impacts stakeholder relationships, it impacts transparency issues, especially with the issue that we've been asking from long time ago, the Malga Bill Gates and Logunitola every year, does it have a political direction, if I may? And I think this has been a question that has been ducked and dived over the years, and I'll take it. But please just respond to the other questions. Thank you so much, Chairperson, for the opportunity.
Thank you very much, Honorable Shirompongo, sir. Can I come to you, Honorable Kumalo?
Thank you very much, Chairperson. Chair, let me join my colleagues for accepting and appreciating the presentation from SAHPRA. I'm just having some few questions. Chairperson, one, SAHPRA has embraced artificial intelligence and will be implementing several pilots as part of the SAHPRA digital migration interventions. How is SAHPRA evaluating return on investment for its digital assets, such as DocuBridge and the engagement portal? And are there measurable efficiency gains? Secondly, has SAHPRA conducted a formal cyber risk assessment, particularly in light of recent health sector ransomware attacks such as the NHLS, and what mitigation plans are in place? Chair, given the lessons from the withdrawal of funding from the USA, and noting that SAHPRA surplus was largely driven by additional external funding support, what is SAHPRA's plan to transition away from dependency on unbudgeted external grants to cover core operational costs, ensuring sustainability if this external funding decreases or ceases? Lastly, Chairperson, in terms of the targets, especially in public awareness campaign, SAHPRA have met their target. I want just to check, Chairperson, in which provinces have they made this awarenesses? What was the outcome of those campaigns? Thank you, Chairperson.
Thank you, Honorable Kumalo. Honorable Mtubatse.
No, thanks very much, Chair. And thanks for the report. I must say, Chairperson, that I went through the report, and I must say I was disappointed. And there are two areas that disappoint me. When SAHPRA appeared in front of this committee, I raised the question on the role of SAHPRA in respect of the preservation of indigenous medicine. And I was raising this question because I'm an African and because I was speaking to Africans. And then when I read the report, I thought maybe I was mad. I went back to their vision, which says that they are an agile and responsive African health product regulator that is globally recognized as an enabler of access to safe, effective, and quality health products in South Africa. And they say their mission is to promote access to health products and protect human and animal health in South Africa through making science-based regulatory decisions. Now, I'm saying I was disappointed because the CEO promised to look into this particular issue. But then in the report, there is nowhere where I'm convinced that this particular institution have taken time to look into this. And the reason why I was raising this particular matters is because, Chair, in the protection of Africans, there are a lot of bogus traditional healers out there. They are legitimate, they are bogus. And following through on what Honorable Chirampongas have said, there are many who have been in the practice, who are legitimate, who want to come in, and who want to help these institutions to make sure that our own indigenous medicine are promoted. Some of these medicines are stolen from our people. Our own medicines are stolen. They are taken to European countries. They are packaged and they are brought back, and our people lose. Now, I raised this question to say that SAHPRA must focus on that and come back and give us a report. Today, we are told about international platforms. This is where we are. No, we want to start here at home. What is it that SAHPRA has done? First, the chairperson says it is our responsibility to engage with the public. But then which public? If we exclude our traditional healers, if we exclude our practitioners, if we exclude our traditional leaders in terms of sharing those experiences. And that is my disappointment. And I implore on the current board, in particular the chairperson, that must look into this particular matter, that next year, when this particular institution come and report in front of us, that we need to get first a dedicated budget in respect of making sure that these doors are opened for our practitioners, and there's thorough engagement in this regard. I implore you, Chairperson, that you look into this particular matter. Now, the second issue, it's what on what Honorable Shabangu have raised. I'm an African, but secondly, I spend much of my time as a trade unionist in the health sector. Now, when workers raise issues, it is a concern. It is not that we hear, Comrade or Honorable Shabang. No, we know that there is ill treatment. We get report of ill treatment, and I'm actually disappointed. I'm really disappointed if the CEO is going to brush off this matter of workers like 10% is nothing. It has been brushed off because there's something. If I may ask, and I think one of the things that I will implore, we need to get an exit interview report, because any institution of this caliber at that level must, of course, be worried when senior leaders leave and there's that exodus. Now, one of the things that you do, you have an exit interview report. And if you don't have, it means that you are careless. You don't have to occupy that particular seat, because you must be concerned to say that, what are the issues? Now, surely, Chairperson, I implore you that we must, within a period of 10 days, that we get a report on what is happening in that particular institution, that we can get in, because it can't be business as usual, that we get reports of ill treatment of workers. There are many issues that are happening there. We are getting those reports. we get them through the workers, through institutions that are there. This cannot be business as usual. Thank you, Chairperson.
Thank you very much, Honorable Mtubatse. It's your turn, Dr. Litlape.
Thank you, Chair. I'll just do a quick video for proof of life. My questions would be less complex than the previous questions that have been asked. The first question is about this CBD, THC, industrialization of cannabis, and the serious challenges that we have. Since the judgment in Cape Town, what has been reported is increased youth uptake of CBD. Underage use has more than doubled. So a judgment that was about adult usage is creating a youth problem. We also see the challenges of drugs in general in our society and almost animal-like behavior in terms of the violence and the cruelty around that violence, which seems to be fueled by drugs. So my question is, what role is this institution going to play in that? Linked to that is the issue of marketing of mind-altering or medicinal products. I see this increasing pharmaceutical advertising. There's continuing and more elaborate advertising of alcohol. What is SAHPRA's notion about advertisements in terms of all these substances that are turning us into a very, very indifferent and violent society? Now, in terms of the Africa Medical Agency, I just want to hear from SAHPRA in terms of how we ensure that we don't lose our sovereignty. We don't end up having to get products into this country because they were approved at the African Medical Agency. When we have this issue of porous borders and fake medicines coming into our country, and suddenly we see a proliferation of pharmacies that look substandard to what we used to see. Soon, drugs are now being sold in flea markets. What is SAHPRA's role in that? And the issue of funding, I mean, the radiation services have been brought to you. When I compare the human resources that you have, the budgets that you have, you're far smaller than the tobacco division in the FDA. What ideas does SAHPRA have of increasing resources? Grants from budgets and donor funding are not sustainable. Is there a plan for sustainability so that you can expand? And I know that when you're given a new job, when tasks are added to you, you should have the discipline to ask the state and the department to resource that task and be brave enough to let it be parked until it is resourced. Because I think there's this challenge from us as lawmakers where we tend to give people responsibilities, but we don't fund those responsibilities. The last question is, we spending a lot of money on cancer and the expensive cancer drugs that are being used as salvage therapy at enormous cost to patients and families. When you do special permits for drugs that are not in everyday use, do you engage on the issue of the costs of those drugs? because those cancer drugs are exorbitant. And there should be a responsibility from SAHPRA to engage on what the costs of those drugs are going to be. Are they going to be made affordable as salvage therapy or experimental therapy? Because there's an issue where there's price gouging and health funds are being used for things that should still be under trial for open health budgets. There's an enormous impact on health resources, whether they are pooled under medical aid or it's our government budget. So I'd just like to know whether SAHPRA gets involved on the issue of affordability of this exotic medicines that might be for special use. Thank you, Chair.
Thank you, Dr. Klape. Dr. Leroux.
Thank you very much, Chair, and thank you to SAHPRA for your presentation. I have had most of my questions asked already, but I just wanted to ask you perhaps to elaborate a little bit more around two of the things that were mentioned. Some of my colleagues who've mentioned traditional medication, it would be useful to understand the challenges with that from your perspective, and how, I mean, of course, there are different traditional medications being used in different parts of the country, and sometimes they are unique to each little individual area or even to each herbalist or traditional healer. And so I just like to understand your approach to managing those medications, because obviously those are going to people, and we need to make sure that they are safe. And so if you could just elaborate on if that, how that works, is it something that you can do, and how it would work for that to be universally sort of applied. The second question I had was just around I guess it's your political independence. You fall under the Department of Health, and you are an entity that is meant to be entirely independence, but I think we can see it all over the world that this independence is being challenged from a political side, in the US, for example, and just if you could perhaps just give us some insight in terms of the legislative safeguards that we have to make sure that when you make decisions about medication, that is that you can stay independent, and whether you feel like any of those safeguards need to be improved. And then the third thing, again, in connection with what Dr. Leklape spoke about in terms of cannabis, where is SAHPRA responsible for overseeing these products that are now becoming more and more available? And what is the legislative kind of loopholes that are there that are worrying to you, and is there any way that we can help as a committee? Thank you.
Thank you, Dr. Leroux. If I may come, I would start by commending SAHPRA on their clean audit outcomes that they have communicated to us. We note that that's an improved outcome compared to previous financial years. The report is saying no irregular or wasteful expenditures, and I think that must be their story going forward. How I hope there was a smooth transitioning between the previous board and the current board. We understood you, Doctor, the chairperson of the board, that you are a new board that has just been appointed by the minister. And we think what is raised by the members of the portfolio committee, those that were advised during our last interaction with the past year, the CEO, the doctor, must be able to advise the board on those issues that were cited in the previous interaction with yourselves. Also, on the issue of you being under-resourced, resulting in you being understaffed, but there was a mention of a over collection on fees. Can't you use that budget to fill up those posts, not getting away from what was raised by two previous MPs to say there is no staff satisfaction in some areas in your institution? You'll remember that as MPs, we are also a voice of the public because we represent them. We are not going to be all members of parliament, but those that are members of parliament also represent those that are not. Coming to my other question is to ask what early warning and surveillance mechanisms has SAHPRA put in place to detect emerging health threats, and how is it collaborating with the National Department of Health, the National Institute for Communicable Diseases, and the World Health Organization to ensure a timely regulatory response? I can't say more on the issue of road shows. I would advise that you conduct road shows so that your organization becomes corrective than being too punitive to the public. And also on what you can say is fake medicines. I think I can, on fake medication, I can say not fake, but unregulated. Let me put it that way. What's your responsibility regarding that? Because as Africans, we believe and in what will make me heal on that particular period. I'm talking about the indigenous medicines. Those that would like to apply, do they understand where the process starts? That's the manner of creating awareness about your programs as the entity. Thank you very much. Let me stop there. Thank you. Sorry for that interruption. Thank you.
Thank you, Chair. And thank you, honourable members, for all of these questions. Certainly, they are appreciated by us. We take them as positive critique in some of the areas and just challenging us to continue to achieve more as SAHPRA. I'm going to address some of the questions, and my colleagues, our Chief Regulatory Officer, will step in, then the HR executive, as well as the CFO will also step in. There's quite a lot of questions, so I'm hoping I'm going to do justice to each one of them. I'll start on the issue of Len and Selenium. My CRO will come in. On the issue, the question around the SIU, yes, the SIU does bring cases to us when there are cases. And really, when we engage with them, the nature of the engagement is around them asking for information. So, for example, at the moment, what we had, the most recent was where we had to submit, a list of companies that were licensed as medical device companies that were licensed by SAHPRA as they were investigating the Tembisa matter. So on many matters, they ask us for information and they then proceed with their investigation. So that's the nature of the engagement then. In terms of ML3, and thanks for asking that question. So just to say, it's not an error in the annual report. We are ML3 for vaccines. It also says that in there. What we're now working on is to be ML3 for medicines. The question also that was linked to that was, why did we not achieve that target? The reason was when we did our own self-assessment, there were still areas that needed quite a significant level of improvement. One I can speak to, for example, and you will remember that the Medicines Control Council didn't have staff at the ports of entry, the sea and the land ports. We needed to ensure that we've got an adequate number of staff members there. So again, linked to the question of what are we using the fees that we're generating for, is for those additional resources that were not part of the previous entity, MCC, and therefore then needed to be included in the SAHPRA structure to make sure that we comply. We have done our self-assessment for this year, and we are very hopeful that we'll get ML3 for medicines. But again, they're coming for the audit in November. We will see the outcome. In terms of the time we take for GMP and GWP licenses, it should be, the target is 125 days. And I've indicated that here one of our big challenges is capacity. When we look at the local sites that we need to inspect, when we look at the sites outside of South Africa that we need to inspect, we don't have adequate capacity. We actually, in January, had an audit by an institution called PICS. They are referred to as the Pharmaceutical Inspection Cooperation Scheme. So this is a global entity that looks at regulators that conducts these inspections. And one of the outcomes there was that we are not adequately capacitated for the amount of inspections that we have to do. So to the question again around the surplus, as I mentioned, every year we look at what do we have within our budget, what do we have within our surplus, and what positions can we fill. You can imagine that, with for this financial year, I think what our surplus was sitting at about 36 million rand. And we've got a staff deficit of close to 200. We're not going to be able to fill those with that little surplus, because the surplus also covers our digital transformation. That's an area, again, that was not funded. So these are the things that we will always have to split our resources against operational projects as well as cost of employment. I'll have on the overspend of program 1, I'll have the CFO just look at that and then comment. And then to go to the next set of questions, so the MOU with BMAs, it's actually quite an enabling MOU, right? Because while we understand that they've got constraints, like we also have constraints, but being able to collaborate means that we can do inspections jointly, our team can engage, and our team can share information. So that's where we've seen the benefit of cooperating with Border Management Agency. The other context to that is that within our regulations at the moment, the only designated ports are the land and the sea ports. Are the sea and the airports. The land ports were not designated in the regulations, which means you will not find a SAHPRA staff at a land board and at a land port of entry, because it's not within our regulations. And that's where also we see the porous borders. We have amended the regulations. They're out for public comment. I think they close now at the end of November. But that what means is that we would need to then ensure that, again, we raise further funding to put people, staff, and train the staff to then be at the land ports. And hence the collaboration with BMA assists, because they've got staff at the land borders. So it's a partnership that has been beneficial. In terms of MPOX, so MPOX, when we authorized these vaccines, they were under emergency use authorization. At the moment, we don't have an MPOX vaccine that has a full registration by SAHPRA. What we do have, though, is a registration of in vitro diagnostic tests for MPOX. So if the vaccine that we've got emergency use authorization for is required, that's the mechanism that would be available. I'm going to weigh in on the matter of staff retention, and as members correctly say, we've had discussions on this. And so there's 3 points I want to mention, right? The first is we have a target. The target is that we should not exceed 10%. We're not exceeding that 10%. Hence, I'm saying it is not a red flag. But does that mean as an organization when people leave, we're not concerned? No, it doesn't. We have, and the HR executive will talk to this, we do exit interviews. We've got reports. We share these reports even at our HRM code to say these are the matters that staff have addressed. We've got a retention strategy within our HR strategy. And based on what's documented, that is what's on paper, staff are saying issues of salary. Our salaries are much lower than what they would get in the private sector. Some of them, and I've mentioned this, is the workload. We are understaffed. Therefore, people find that they're working harder at SAHPRA, if I may put it that way, than they would at another entity. I'm speaking, even in this meeting, around all the mechanisms that we're putting in place to bring in additional capacity. That's why, since I joined SAHPRA, we've been able to raise external grant funding to fill in roles. The previous entity didn't have that because we are an executive team that says, where there's a gap, how do we fill that gap, right? So we've been able to appoint people using grant funding, but you all are aware of the context around that. And we're trying to say, how do we then build that into our current cost of employment? The one point I would really like to urge members on, and I did this even in the prior meeting, to say, when you are aware of staff or members that come to you and raise issues, the same way we have a responsibility to address this. I would like to believe, and I'd like to urge the honorable members to bring that to our attention. If I do not know the details of who says they're being ill-treated, there's absolutely nothing I can do. You need to empower me with information and with facts. So I will restate it like we did the last time. Please do share with us those matters that are brought to your attention so that I can address them together with the executive team. What we have on paper, I mean, the point of favoritism, this one is certainly the first time I'm hearing. The point of ill treatment, people raise grievances. We give reports on this to the HRM quarterly, where there's a grievance raised. We say, what have we done to deal with that grievance? How long have we taken? So we've got mechanisms within the organization to deal with these when they're reported to us. However, if they're not reported to me, if they're not reported to executive management with the facts and the details, there's absolutely nothing we can do. So please do report these to us. In terms of the website, yes, on the 6th of October, we did have our website down. We're still dealing now with the service provider. There is an issue that the IT team and the COO are dealing with it. Even today, there's a whole outage in Tshwane. So again, we're battling with access to our website, but this is broader within the Pretoria area. So what we have is certainly a business continuity plan that has been put in place. And when things like this happen, we kick that in. So for example, today, we said to staff, they must work from home because we were back today. They must work from home and access, and then we'll come back and hopefully we get feedback from the municipality. There is a generator backup power that's running at the organization, but we don't want that to be affected. In terms of the website, as I've indicated, the IT manager and the COO are addressing this. So thank you for flagging these with us. On the resource constraints, I'll have the CFO talk to that. The issue of the African traditional medicines, and again, we reported on this in the prior meeting, but happy to then have a specific section in our report that deals with it. And the reason why there isn't a specific section is because we've put together a working group led by Prof. Matsabisa from the University of the Free State, wherein they have, we've asked them, we've put in place terms of reference, and have asked them to look at this area of African traditional medicines and recommend what regulatory mechanisms we can put in place. That working group has got experts in traditional medicine, it's got legal people, it's got people like Prof. Matsabisa who do research, and he also sits on the WHO committee. So they have shared with us their recommendation. This work was supported by the Department of Science and Technology, and we're busy now considering those recommendations. So there is work happening. It's not probably moving as fast as we would like, but please rest assured that there is work taking place to say, how do we regulate this? Because the one important recommendation that comes in there is that it would require a different regulatory framework to what we have for orthodox medicine. So we want to make sure that we apply due diligence and also consult entities like the WHO that have frameworks on African traditional medicines. The second thing is, once we put out regulations for this, it would mean that we must have capacity. At the moment, we are undercapacitated in our area of what we call complementary medicines, wherein the African traditional medicines will most likely fall in. So we need to consider, once you say you want to regulate certain products, you must have clear regulations. They must be put out for comment. We must conduct a regulatory impact assessment study, and then eventually capacitate and implement. So it is a process that's going to take some time. I really don't want to promise that it will be in effect immediately. It is going to take some time because it requires regulations. And then I'll just address the few questions we got around cannabis and hemp. And again, as we've indicated in the last sets of meetings, that what we have done as SAHPRA is we regulate only cannabis when it's used for medicinal purposes. What we did in response to the court judgment and what we did in response to the Pakisa that we've reported on is that everything that is non-medicinal has been moved to the Department of Agriculture. So any hemp-related types of applications or industrial types of applications for permits, all of that now sits with the Department of Agriculture. When we did the move, I think it was about over 80% of the permits that we were issuing at the time that were actually for agricultural purposes. So that's what we've moved. So we're left with quite a small number, which are largely for medicinal purposes. What we've also done is, in terms of the schedules, CBD, if used for medicinal purposes, is a Schedule 4 at specific quantities and concentrations. THC, Schedule 6. And if CBD is used at lower concentrations, we then consider it a Schedule 0. So as we speak, we do not have any applications for registration of CBD or THC containing medicines. What we have are applications for licenses to cultivate. And those licenses are if you're cultivating for medicinal use. Now, we constantly get a question in different platforms around now these shops that you're finding in the malls, these kiosks that are selling CBD containing products. Now, that is not within the ambit of SAHPRA, especially when they're not making medicinal claims. These are foodstuffs that are ingested. So the Department of Health Food Directorate is the one that needs to step in and regulate those products. Secondly, wherein they are not compliant with the Drugs and Drugs Trafficking Act, it is then the law enforcement agency, the Department of Justice, that must step in. Wherein when we go to these facilities and they make medicinal claims, then we step in and we regulate, because the important thing is that we need to make sure that we regulate what is within the mandate of SAHPRA, and other stakeholders regulate what is within their mandate. My colleague will talk to substandard and falsified products quite broadly, and she'll tackle the few questions that we got around that. And then in terms of the funding, again, we have spoken to this to say we've got a policy, happy to share that policy that guides us how and when we can receive funding. And all the funding that we receive has to be compliant with that policy. We also report on this policy, on this funding quarterly to the board, and you will also note that the details of this funding that we receive, and it's not only from the Bill and Melinda Gates Foundation, actually the biggest source of funding we have is the Global Fund. So it's not even the Gates Foundation. And we report on that in our annual report. And we again have a policy that guides how we do so. We've been audited against this policy and we're found to be compliant. But honorable member, I'm happy to share that policy with you. On the return of investment on our digital tools, I have our CFO talk to that. In terms of the risk with AI, absolutely, we had a 2-day stretch session wherein we spoke about matters of risk, matters of data security, and all of that. And we're busy now putting in place all the required policies. We haven't fully rolled out AI. As I mentioned, we're busy with proofs of concept so that we can learn, we can see the proposed time saving, we can cost those tools, and see how much it's actually going to cost us to roll out. So this is still early days for AI. And then in terms of the use of our surplus, the CFO will talk to that. On the webinars, I mean, these are digital platforms, right? So what we do is we work with media to invite all stakeholders across the country. What I cannot speak to with the level of certainty is to say the participants in those webinars, where do they come from? But what I can say is that we've also engaged with with community radio stations. We have quite a lot of engagements with radio stations in the Northwest and in Limpopo. The one area where we're struggling because we don't have enough staff to represent us in the language is in KZN, but we are working with our comms team to see how we can build the capacity. So one of our constraints is certainly about communicating the work that we do in our indigenous, in our local languages. We really, really are battling with that, but it's something we're addressing with the comms team. On the ATMs, I've spoken to that. Just to add also that we do not regulate the practice of traditional healers. So our focus would be, even when we then regulate African traditional medicines, would be limited to the products, but also the products that are commercial. So if a gogo somewhere is giving you a medication or products for you as an individual, which is called extemporaneous use, we also are not going to regulate that. It will only be those that are for commercial use. But even with the traditional healers themselves, I know there's a regulation that's in place within the oversight of the Department of Health for regulating traditional healers. Yeah, I've spoken to the point about staff exit. I wouldn't say there's an exodus, but there are people leaving. Certainly, there are people that we've tried to retain and they've said no, they can't decline those offers. Some of them have said no. They want, jobs that are not as intense as SAHPRA, but certainly we've got a retention plan, and I'll let the HR executive talk to that. CBD, again, I've spoken to that. On that question around AMA and losing sovereignty, I'm absolutely not. And I mean, this is something that is enshrined within the AU laws, that each country retains its autonomy. So even when AMA is to make a decision, no manufacturer can just make those products available in any country. They must still go to the countries, make a submission in that country. And what would happen is that then the submission would rely on the work done by AMA and issue its decision. So very different to the European model, wherein if the European Medicine Agency makes a decision on a medicine, it's rolled out across all EU member states. Under AU laws, it will not be the case because every country retains its autonomy. So yeah, no, please, just to say, there we will make sure that there is certainly compliance with the AU laws. In terms of sustainability, I mean, I agree, we've looked at different mechanisms, and one of the areas is to ensure that we charge for all the services that we are meant to. So over the next few months, even into the next financial year, members and industry will start seeing us charging us fees for some of the areas that we have not been able to charge for. And those fees will enable us then to capacitate some of the areas. This year, we are developing fees for radiation control, And again, we need to grow that area. We will be focusing on complementary medicine, growing that area. We'll also be focusing on medical devices in the next year and then growing that area. On the question around the cost of cancer drugs, just to say that within the Medicines Act, we are not mandated to look at the pricing of medicines. There is a pricing committee within the Ministry of Health who have a oversight for the pricing of medicines. And then the question around our independence and, oh yes, safeguards. So traditional medicine, I spoke to that. On the question of safeguards and whether, there's independence of SAHPRA, I think certainly, I think there are many elements or areas within the Medicines Act that enable us to have autonomy. Specifically, even when the department, for example, would like to access a drug that's not registered, they have to apply for a Section 21. If there's a product that is out of stock, they would communicate to us formally to say, can you accelerate the review? So there's a very good and a very clear means of engagement with the National Department and any other department for that matter. And I think within the Act, we have those safeguards. And an important safeguard for us is the requirement for us to make evidence-based decisions. And if we don't have that evidence, we then are not able to issue a regulatory decision. The early warnings to detect any emerging health threats. No, absolutely. This is an important question asked, and we are collaborating and working on various platforms with the National Department of Health and other stakeholders where SAHPRA is a member, and we work with the broader health sector in the country to respond to any pandemic or any emerging threats. Chair, I'm going to pause and ask the CRO to comment on some of the questions, then the HR executive and the CFO, please.
In order.
Thank you very much. I'm putting my camera on briefly. I am in commute. We'll just switch it off. Thank you very much, Madam Chair. I will go into lenacapavir at first. This product is going through the review stages. So it has been approved by 3 of our areas, and the 1 area is still under discussion with the applicant. We have a 90-day turnaround time, and we're confident we will meet this. On the selenium, just to let you know, with selenium, it's not to be used for children as per the complementary guidelines. But selenium, when supplemented to children, presents a safety concern. So the issue is that products on the market are claiming immune boosters as well as cold and flu and diarrhea and other skin conditions. So we have what we call complementary medicines, which is a category D, and selenium is not for use in that range. But we have category A, which is your normal medicinal use, and applicants can put through submissions where the data will get reviewed. With regards to fake medicines, and the questions that it may slip through the borders and what are we doing as SAHPRA, an update on that is that SAHPRA had launched a national action plan together with the WHO, formalized or endorsed by the minister last week, actually. This was a year-long project plan to look at a pilot for a national action plan, which would be to strengthen, detect, prevent, and respond to substandard and falsified medicines in our country. So it was a multi-sectoral commitment, and it involved a number of stakeholders. Part of this launch now requires the hard work, if I can say. Over the next 3 years, we have a commitment as stakeholders to do awareness campaigns. Just for your information, SAHPRA has been on the media or talking about counterfeit medicines. This took place even last week. Again, over the next 3 years, we as SAHPRA want to increase the frequency of our testing and the sampling of testing of products from the market, with the hope that SAHPRA can eventually have their own lab. Right now, we have a contracted services with the lab, which the CFO alluded to in his presentation. We want to investigate online detection of substandard and falsified medicine using an online tool to detect these fake websites. We have also launched a guideline last week. It is called the Traceability and Serialization, where we are asking industry to now use GS1 coding on their products. It's a staged approach where applicants will now add this on their pallets of their products, and eventually it will get onto a unit carton or a product. This then gives information to consumers or anyone in the public using this particular code on the authenticity of the product. So there's a number of activities. I want to also elaborate on the role of our regulatory compliance department, which undertakes these investigations. I think one of the comments made was on promotion, etc. So when we get these complaints from the market on promotional material, either via our website or our whistleblower line, the promotional material or any detection of illegal sale of medicine, we have our regulatory compliance team that comes in and investigates those particular products or complaints, goes into a facility, and thereafter, if there's enough evidence, the case gets referred to SAPS for criminal prosecution. So those are the activities. I think our CEO has already mentioned the Mpox vaccines. That trial is under discussion with our clinical trial committee at the moment, and it is in advanced stages. I thank you very much. I will pause there.
Thank you. Were you done, CEO?
No, if the HR executive and the CFO, please.
It's their time as proposed. They must take the platform.
Okay, thank you, Chair. Thank you, Dr. T. So I'll start with the exit interviews. So currently the exit interviews feedback show trend where employees leave, citing career growth and opportunities on remuneration. While they reflect in terms of remuneration, as SAHPRA, we have a project that we are finalizing. We're at the benchmarking stage where now we're making sure that we benchmark remuneration for the employees as well as part of the retention. And when it comes to the fact of building capacity or career building, we also implementing a structured internship and graduate program. We have ComServe that we get the ComServe from NDOH, but as SAHPRA, we want to implement those programs so that we're able to build a talent pipeline, attract talent. And to add on that, we do have career days partnering with the universities. Sefako Mokhato, we've attended, we went to UCT and so forth, because we're creating that pipeline, visiting different universities. So, and to add on what the CEO have said as well, in terms of our target being below 10%, we do acknowledge that even if it's below 10%, we have people at management as well leaving SAHPRA. And to close that gap is to make sure that we've got clear career path, especially at that level, in terms of managers and people below, understanding their career path in terms of progression within SAHPRA, and introducing as well leadership programs within SAHPRA. We have many people that are experts and they specialize in their field, but as well, we're looking at introducing senior management programs and new manager programs, because the biggest challenge as well, we had one of the senior manager who left end of March, and he said that his biggest challenge is to lead people. So we also identified that gap, that we need to enable our managers to as well be able to lead people, to have team dynamics and be able to get results through the people that they lead. So those are the other challenges that we have in terms of having especially people at management leaving because they don't want to own that people management function. And we've got as well initiatives how to close those gaps. Thank you, Chair. Dr. T, please let me know if I've answered all the questions around people.
Yes, you have. Thank you. And Rahmat?
Thank you.
Thank you, CEO. The question on overspending on program 1, It's mainly due to external funding. So as a way to mitigate the risk of withdrawal of external funding or the limited duration thereof, it's not included in our SAHPRA budget. And you will see a note on page 37, just a paragraph below that table. We did put a little narrative there that it's mainly due to the external funding support received. Also, you can refer to note 22 to 25 in the financial statements, gives the breakdown of that external funding support that we've received for the year. But also to link to the question on the percentage spent against the budget, on page 111 is our statement of comparison of budget and actual expenditure. And you'll see the financial performance against the budget there of SAHPRA. Then there was quite a couple of questions linked to financial constraints, the risk of withdrawal of funding, the funding for RATCON, and the use of over-collection of revenue, basically. And it sort of has a similar response or same response. So I'm going to address all these questions. So with financial constraints and the backlog question, so we also have to mitigate that or to assist with that, we've got a pool of external evaluators that we can draw on in terms of additional resources that we use to try to address that specific constraints. Then also with the risk of withdrawing of external funding, we have plans in place to try to absorb these positions as our funding or our own internal revenue generation grows per financial year, but also to mitigate the risk. The positions that are externally funded is also linked to the contracts of those positions are linked to the external funding period to mitigate the risk of not having committed to that and not having funds to pay for those salaries. But we do plan to absorb. We're planning to do for the next financial year about 17 positions, and maybe a bit more as we finalize our budgets for some of those externally funded positions, because we don't want to lose the expertise gained and learnings made whilst they were working at SAHPRA for that contract period. Also, in terms of mitigating the risk of withdrawal of funding, CEO spoke about the new fee regulations we want to issue, of which RATCON is quite at advanced stage, and we're hoping to issue for public comment closer to the end of the financial year, and that should bring us in substantial revenue as well, and that will assist them in terms of the question asked for funding for RATCON. So we're trying to mitigate that risk by the new fee regulations. In terms of the question of overcollection, how we can use our surpluses. So annually we have to apply to National Treasury to retain our surpluses, and we've done so this year as well, and have applied to retain these surpluses to fund some of the contracted positions that we have going into the 25-26 financial year. It is very difficult to motivate for that because the retention or these additional revenues are basically limited to a financial year or specific financial year. But we've been engaging National Treasury on that to try to retain that funding. As CEO said, our resource constraints, we really do sit and plan quite well from a human resource planning perspective versus what we can afford going forward, to see how many of these number of unfunded positions we can actually fill per financial year, doing it in a responsible way and not over-committing the institution financially. It is a very difficult balance, but we do try our best to do that. And you'll see in that slide where our cost of employment has grown with our fee revenues, we really try and add positions. We've added about 57 positions since 2022, which does come at quite a big cost, because these are usually specialized positions or professional positions that we have to fill. Then there was a question on return on investment of digital assets. So it is quite newly implemented, and we're currently running a parallel process. And we've not yet done that specific assessment because we've only done about 3 workflows of about 36, and it will take some time. The estimate's about 4 to 5 years to fully digitize all our work processes. But to move away from Excel spreadsheets where all this data is contained already we can see on the document system and portal, we have actually clear and visible sight and are able to track these applications on a live system, which is a huge efficiency gain by itself. But we do have some estimates, and we think about 33% efficiency gain should be achieved from investing in these assets and these digital assets. Just on an ICT security risk, we've deployed a SIM solution as a ICT security system about a year or two ago to assist us with that. We also made funding available for a ICT security specialist, hopefully to be appointed in this financial year to assist us to manage that ICT security risk that we have. Thank you, Chair. I think those are all the questions, finance-related questions.
Chairperson, I don't have the means to raise my hand. I don't know if it's appropriate for me to just come in. I just thought I should.
If it's a board chairperson, can you wait a bit? There is an assignment that I will ask you to do before you come and make your closing remarks. Board chairperson, Doctor, I wanted to ask some question to say, are the traditional leaders associations representatives from those organizations forming part of your stakeholder engagement? That's just a direct question. And also, I want to bring to your attention that as a portfolio committee, we have an interest in the governance structure, meaning the board. So the CEO did assist you in making introductions, also introducing the board. But I would suggest that before you make your summing up remarks, those board members that have connected as a meeting, we must see them to see that this is Dr. So-and-so, this is Ms. So-and-so, Mr. So-and-so in the governance structure. We are a committee that is so active and in the ground. So when we meet those people, we must be able to associate them with the entity. So I was not stopping you. I was giving you an additional assignment before you sum up. Over to you, Board Chairperson.
Thank you. Maybe just to continue on that last point that you made, I'm going to request that the board members who are on switch on their cameras so that the committee members can see them. I hope that they're in a place where they can have their cameras on. And then I'll introduce them by name. Okay, so we've got Professor Glenda Gray, who is the vice chair. I think you can see her there. You can just wave Glenda for the guys to see, but your name is there, so they should be able to see it. And then we've got, of course, Dr. Dumisi Mehta, who's the CEO as well of the organization. We've got Professor Rajesh Mahabir. I think he seems to be walking, so. And then we've got Dr. Tobeka Boltina. So these are the members who are with us, Chairperson.
Are you able to see the members of the portfolio committee? No. Were you in a chance to identify them?
No, Chair.
No, Chair.
The answer is no, Board Chairperson.
Oh, that's interesting because I can see them. Maybe
but if it's impossible for them to show up, we will agree. But if it's possible, they must.
Chairperson, I imagine that there might be a problem with connectivity on the other
side. I can see them all. I think we just have to make sure that we have the right view on our computers. If we go for gallery or multi-speaker view, we should be able to see them all. So if we go into the top right corner of our screens and on view, if you put on gallery, I think everybody is visible. Thank you, Chair.
Wonderful.
Thank you, Dr. Leroux.
Chairperson, I know that I suspect that we might be straying for time. I just thought I should touch on a few points relating to the questions that have been asked before we round off. The first one is relating to the questions about staff attrition and unhappiness within the organization. We are obviously coming into the organization, we just came in a few weeks ago, but we are aware, it's not a secret. I mean, I think all of us have even seen on TV that there have been marches to the minister's office by some employees and led by their unions relating to a number of issues that they're unhappy with. The CEO and the team have obviously provided you with objective data speaking to some of these concerns that have been raised, but it's quite clear that there are some subjective elements to the issues as well. It's obviously up to us as a board, collectively with the management, to try and fix whatever it is that's there. Because whereas maybe the data might be showing something else, it is of course concerning if you start seeing people picketing and making marches. So I just want to give an assurance to the committee that we will look into these, whatever the issues might be within within the organization, and hopefully ourselves and the CEO will be able to work together to manage them. And like I said, it's very easy sometimes for us as a board and it's preferable in most cases to allow the CEO and her team to run the organization. But I think where they are glaring issues of concern, then it really behoves us as an oversight body to come in and mitigate some of the risks that might play out in that regard. So that's the first thing. The second thing with regard to independence, some of the operational deficiencies, for lack of a better way, that might have been identified, I think will be addressed by the SAHPRA bill, which is in the offing. And we all know that, for legislation to be amended is quite a long, protracted process, but there have been some gaps that have been addressed through the new bill that's in process. But independence comes in different ways. Primarily for me, it's also about who sits on the board. And we all know that in South Africa, board membership has been a topical issue of concern over the recent past in terms of how boards are appointed, who gets appointed, and the skill sets that they possess. I have to say I feel quite privileged in the pedigree of people who are on the SAHPRA board right now. Wide range of skill sets, fairly strong-minded, strong-willed individuals. And I think that's a useful layer of defense to ensure that if there's undue influence, board members can stand their ground and push back appropriately if there's a need to do so. So that's the one thing. But there's also a trend that I sometimes I don't know whether it's only in South Africa, but I've only ever seen it here, where independence is measured by the extent to which an entity acts against government. And I don't share that view. I think independence is not opposition to government. We're still a government entity. We're still, beholden to the interests of South Africans. And I think where political leadership is through yourselves as the custodians of the interests of the people, guide us to act in a particular way, we have to be responsive to it. So independence does not mean essentially doing what we want. And I just needed to highlight that sometimes when the government programs and we align ourselves with those government programs, we're seen not to be independent. But that is our role. We're an enabling entity for the state to achieve whatever objectives it sets out for itself. So for example, if there's an NHI, we have a responsibility to be responsive to that because people who are running the country have determined that that's the path that the country should pursue. And so independence is not just one-dimensional in the sense that we act in a way that pleases one interest group over the other. We have to balance the interests of all the stakeholders. And then the big thing here really that I need to respond to as well is the question that came from Honorable Member Mutubadze and Chirwa Bungosi about traditional leadership. Not leadership, rather, traditional medicine and Chinese products and all these other products that are on the market. In South Africa, there's some conversations that we avoid, we shy away from because they're very uncomfortable. And I think one of the failures of leadership, in many instances is is the inability of people in positions of authority to have uncomfortable conversations so that we can ultimately resolve some of the intractable differences that exist in the country. So healthcare, from a regulatory point of view and from a science point of view, has got its own peculiarities that other professions don't have. So for example, if you take the built environment, there's no alternative civil engineering. There's no complementary civil engineering. So when you build a bridge, the regulator that assesses whether you've constructed the bridge along the correct engineering prescripts does not have to deal with contending philosophical worldviews about how a bridge is supposed to be built. We all know that if you build a bridge, cars must drive over it and people must not, it must not collapse. But with healthcare, it's very, very different. It lends itself to also beliefs, not just the science. And those have to be balanced against the science. So I think as a country, at some point, we will have to have a conversation and decide if we're going to be regulating all these disparate, fragmented areas of healthcare. Are we adopting one philosophical approach? Are we clumping everything under one and saying it's a science-based approach? And therefore, if you comply with these standards, you get a tick. If you don't comply, you don't get a tick. Because the truth is that it's very, very challenging. And I'm not a regulator myself, technically. And we just joined SAHPRA now. And as a board, we'll have to craft a strategy going forward on how we respond to these concerns that have been raised by honorable members about regulating all these other areas that are very challenging, because the truth is that the individuals who craft the regulations, the entities that we align ourselves with globally and continentally, use one standard approach to regulate, and that's science. Now, because of the sensitivities that come with other traditional practices which do not conform to what's referred to as the Western standards, we shy away from having those conversations and saying, maybe we are struggling to regulate those areas because they do not conform to the worldview that we've constrained ourselves to. So how do we solve that problem? Do we change how we regulate? And if we're going to change, are we going to say that we regulate a pharmaceutical company that produces paracetamol differently to an entity that produces a different type of medication that treats even some conditions that are not defined in the medical textbooks? Those are the realities of our country. And I think our inability to have those uncomfortable conversations culminates in the questions that have been asked by the honorable members and by the extent to which the regulator is maybe not being seen to be responsive to the demands of society. So that's just the high-level point that I needed to make, Chairperson, that it actually goes beyond just SAHPRA's inability to regulate. It's a societal conversation about what science means or what regulation means within our society. Now, you've asked the question about whether in our stakeholder engagements we've spoken to traditional leaders, and the answer is no, because we have not started with our stakeholder engagements as a board. The entity has been having stakeholder engagements before our tenure, but we have to, as a board, collectively determine our own path on how we're going to engage the various stakeholders within society. And without a doubt, traditional healers will have to come into play as well. And there are, of course, limitations in the extent to which we can engage, because ultimately we are still a regulator. We cannot solve some things that belong, for example, in the House of Traditional Affairs and all those leadership issues. So we still are constrained by the act that governs us, and because we are a creature of statute. But however, that's not a defense against not acting to fix some of the problems that we see, because
Can I interject you? Can I interject to my apologies, Doctor? I was referring to traditional healers, not leaders.
Oh, okay. For some reason, I wrote leaders.
Thank you.
No, even the healers we've not engaged, Chairperson. But like I said, it's only because we have not started to engage anybody yet since we started. We have only spent the last few weeks trying to familiarize ourselves with the entity from a governance point of view. And when we came in July, there was time for the AGSA. So that took up a bit of our time as well, which is now we've got this clean audit, which I said we're only owning because it's clean, but the work was done by the previous board. So I'll stop there, Chairperson, because I know that we are constrained for time, but I just thought I should highlight some of those things. And I'd like to give an assurance to the Honorable Member Mutubasi that, we will provide feedback next year when we come back to you about, the issue that you raised about traditional medicine. I'm not saying that we will by then have a fully developed regulatory regime, but I would hope that we would have feedback about what has been done over the preceding year about this contentious topic. Thank you.
Thank you very much, Doctor. I think your team and yourself have done a lot in trying to respond to what was raised by honorable members. But I must make this proposal to say, if there is an afterthought, maybe you think that a certain or a particular question has not been responded to adequately, you are free to make a written response, channel that to our committee secretary. It will reach the committee in that manner. Thank you very much from your team. I hope, honorable members, you have got the responses. If you feel anything that is you asked has not been responded to, it is also vice versa to write back and say my question was not responded to according to my understanding. It's a two-way form thing. Thank you very much to the team of SAHPRA. It will not be until we meet you next year. It will not be that. We will continuously engage you as an entity because you have highlighted that you are new in the office as a board, but the CEO and the team were also with the previous board, and some of them have long been working in that space. I think you will gain experience, but I think as a portfolio committee, we will decide when we need you, when we engage as the portfolio committee sometime. Thank you very much for your presentation. Thank you very much for your responses. Until we meet again, you are released. Thank you very much.
Thank you, members. Have a good day.
Thank you.
Thank you, everyone. Bye-bye.
Thank you. Bye.
Bye. And bye.
Thank you. Miss Majalamba, whilst you are establishing readiness of the next presenters, I can give 5 minutes for the members to stretch whilst you are establishing even connectivity of those of the team that is going to come next. Members, we can stretch and do whatever we want to do. The time now is 12:30. At least just 5 minutes, members, so that we start with the next presentation. Was there any proposal, Dr. Leroux? Okay, just that break, members. 5 minutes one, please. Good afternoon. Oh, let me close my other phone. I was changing gadgets. My apologies, honorable members and the team. Good afternoon, South African Medical Research Council. You have landed to your destination, which is this portfolio committee on health, as per the invitation that was extended to you by our committee secretary. I welcome you on behalf of the portfolio committee. You have come to table your annual report. We will engage with that annual report after you have tabled. But there are house rules before I can give it to you, that when you start with your introduction of your team, you will unmask yourself like I have unmasked myself, so that you can see me. Tlego is my surname. I'm the acting chair of the Portfolio Committee on Health. I am with members of the Portfolio Committee here. You will see them when they are recognized to speak. At the beginning, they will unmask themselves so that you are able to put a voice to the face. You must also do that, but during presentation, you can unmask yourself so that you remain having a good and better connectivity. Good afternoon again to you. We welcome you to the Portfolio Committee on Health. Over to you. You can start with your introductions. Then whoever is going to lead the presentation will, after the introduction, start with the presentation. Over to you, South African Medical Research Council.
Good afternoon, Honourable Chairperson Gregor and Honourable members. Thank you very much for this opportunity to present to you our annual report. My name is Professor Liesel Tuke. I'm the Vice President of the South African Medical Research Council, and I'm joined today in our boardroom by Dr. Mongezi Mdluli and Mr. Sibuyile Ngqokwa, our CFO and our CROO respectively. I also would like to acknowledge with thanks the presence of our members of our board, in particular the chairperson of the board of the SAMRC, Professor Johnny Maklangu, the deputy chairperson, Professor Bonga Chiliza. We also have in the room today Dr. Zintle Makatini, Ms. Doris Dondo, Professor Rudo Mativa, Dr. Madikazela, Professor Mavundla, and Professor Mokeho, as well as Professor Tim Tucker. I am at the moment not able to see if anybody new has joined, but I am sure there are other members of the board that may be joining as well. And you may see that all of us, all our honourable board members have unmasked themselves, so you can see them, and we will also give them an opportunity at the end to speak. I also need to extend sincere apologies on behalf of our President and CEO, Professor Ntubeko Mtusi, who is on travel at the moment and unable to join us. But he has had a review of all of our slides, which we've sent to you, and thanks you for the opportunity as well. So I'm going to move on to our presentation. I see we've taken the cameras off, but as I've mentioned, we will allow our board members to make certainly remarks as well as answer any particular questions that is directed to them. So I'm going to start. So as I've mentioned, really an honor to be able to present to you today. And our theme of our report is the art of science. Moving to our next slide. Okay, so this is the outline. We're going to do some introductions, which we've done already in a way, but I will do that where you can see the entire organization. We start with human resources, then we'll move to performance information, financial information, and stakeholder engagement. And as I've mentioned, questions could be directed at myself, but also my two colleagues in the room. So as we we always start with our health and history slide, which we feel really is the basis in which we work and in which we operate, recognizing the persistent consequences of colonization and apartheid, in particular around education and health inequalities. And we acknowledge, as well as acknowledge the history, but also recommit ourselves, our capacities, our resources to the continued promotion of justice and dignity as we undertake health research in our country. Our mandate, as you can see there, is mandated by the MRC Act of 1991. There has been some amendments, and this is really to improve the health and the quality of life of all South Africans. And we realize this through research, development, and technology transfer, ensuring that we achieve the vision of a healthy nation through research, innovation, and transformation. Our values are outlined below, and we stick very firmly to that in everything that we do and undertake. Those are pioneering, excellence, respect, partnering, integrity, and then in citizenship. This is our board. You've seen some of the members of our board. We have a very engaged, highly skilled board. This was at the beginning of their term. And again, we acknowledge the presence of the board chair, the board vice chair, as well as other members of the board. This is our executive management committee, led by our president and CEO, Prof. Ntobeko Ntusi, who's been with us for just over a year. And then we have the rest of the members of the board, of the executive management committee outlined there. And again, important to bear in mind that we have in our committee members that are very skilled in the various areas that we represent. Moving on to human resources now. This is our employee number and our profile by gender. It's important to understand that in the health research ecosystem, we find generally across the entire ecosystem a proportion that is around 70% female, 70% women. And so this is very interesting to see that this is the case in the Medical Research Council as well. If we look at the profile by race, as we need to report this every year, you can see that 57% of our employees are African. We look at our senior management by race again, and here we have looked at the last 3-year periods. You see we started at 41% in 2022 to 23, being African. And if you look right across to the other side, you see we had 41.5% in this final year. This is our senior management by gender. Again, you can see the majority are female, 58% in this last period. Our executive management committee by race, obviously this is a small committee, so 1 or 2 changes makes a big difference in terms of the numbers, but you can see in 2024 to 2025, 62% or 62.5 is African, and you can see the other percentages there. And this is also in gender. At the moment, we are 50% male and 50% female on our executive management committee. If we look now at the distribution of scholarships and career award research grants, which is one of the core functions of the SAMRC, which is around research capacity development. You see these can be divided into two areas. Firstly, the scholarships that are given. This is given to people, and then the research grants, which are given more to a program, sometimes under the guise of a particular person. And there in green, you see the scholarships. There are essentially 5 areas listed there. And this takes people from very early on in their academic career to much further on where they are now well established. And then the research grants do a very similar thing where you see this growth of their research career being supported by the MRC from the first grant all the way to, for example, a well-established research career like a mid-career grant. You also note that we have specific programs in green at the top, the Researcher Development Program, as well as the Vaccinology Specialized Training Program. And then in orange, you see, for example, the Research Capacity Development Initiative specifically for HDIs, a nested PhD program, and there's postdoc programs as well. If we look at the growth in research grant funding, you see a gentle slope there from 2020 all the way through to this particular last reporting year, with more and more research recipients being able to benefit from SAMRC research funding. Here we're looking at the gender of the research grant awardees. Again, that 70% number continues even across the last 5 years. And you can see that the ethnic groups have also changed and developed, where we now focus on Black African up to 64% in this last reporting year. You may see this as an interesting slide where we see that the top 3 universities that have been supported in the last year are research intensive universities, but what we also see is that we are much more spread across the entire spectrum, with multiple universities now benefiting. If you compare this to many years ago, there would have probably only been 1 or 2 or 3 bar graphs, and so this is actually representing in itself a measure of success. If we look at the research that we've been conducting and its impact at a glance, of course, our research focuses primarily on the quadruple burden of disease, maternal, newborn and child health, non-communicable diseases, violence and injury, HIV, AIDS, TB and other infectious diseases. But if we think about the paradigms that we're looking at, these include disease and disease mechanisms, health systems, settings and policy, and then population health, being very important themes throughout all of these research areas. We have multiple programs that fit under those categories. So again, health promotion and disease prevention, maternal, child and women's health, communicable diseases, biomedical research, public health innovation, and health system strengthening. And so within the various units, we fit under these blanket areas. Here in a little bit more detail, our intramural research units, our extramural research units and centers, that falls under my line. The platforms fall under Dr. Ndluli. Research capacity development and grants innovation and product development falls under Dr. Mulder. And then strategic research initiatives fall under myself and Dr. Mulder. So we're covering all of the areas that we've talked about before under those various headings. This is quite a large slide, but really to highlight the point that we support health research and innovation through not only our baseline funding, but also through very important strategic and carefully thought out partnerships. And so this drives an ecosystem approach where we actually not only support cutting edge research, but we're able to facilitate the translation of this research into policy, into products, and into practice. So we have these coordinated ecosystems. I will go through a few examples with you after this, that allows us to address priority areas, in particularly around our national health needs, which includes pandemic response and preparedness. GIPD also looks at things like vaccines, medical devices, diagnostics, and then indigenous knowledge systems and plant-based medicines. And it's important because this allows us to be more resilient when it comes to funding, but it also allows all of the elements of a partnership and an ecosystem to be supporting research going forward. So this is an example of the funding programs. I know we don't have time to go into each of the details, but you can see in the darker blue is our strategic projects and programs. In the lighter blue, the grant programs. Then in grey, you see, and grey and green, you see the strategic funding partnerships. One of these is SHIP. So you see that as well. That falls then sort of cross-cutting between grants and innovation. And then on the right-hand side, you see our technology transfer, our global health innovation accelerator, as well as the tier seed granting. Here is an important example, the SHIP program. This is a partnership between the SAMRC and the Department of Science, Technology and Innovation. And this is really taking our research into innovation and aid to move into products. We have students that have been supported, as well as multiple teams, for example, at HDIs, such as the University of Limpopo and the University of Venda. A particular example is the UCT H3D team led by Professor Kelly Shibali. Even though we've funded at UCT, we've also funded his program and the work that he's done at the University of Limpopo and the University of Venda. There is also a team, Dr. Munyenga at NICD, very important program looking at sterilization of male mosquitoes working in KZN. And then you see SHIP has also hosted these priority setting meetings so that we can inform the funding strategy for not only the SAMRC, but also SHIP over the next 5 to 10 years. So here just focusing on the priority areas that are funded through SHIP. You can see HIV, TB, non-communicable diseases, maternal and child health, AMR, malaria, and then of course COVID-19. So all of these are critical and priority areas. And then you can see we are focusing on not only on a particular area, but across the board from treatment all the way through to precision medicine. This is the Grand Challenges South Africa, which we are the convener for. There are prior programs listed there, and the new programs are very exciting ones: climate and health, public health information, and of course, artificial intelligence. So this also shows that we're on the cutting edge of new and innovative research going forward. And you can see that there are going to be, that we were also involved in establishing other Grand Challenges partners across our continent. This is our mRNA technology transfer hub, the entire R&D system, quite complex to go through in a very short period of time. I draw your attention to a few areas. One is that we providing this more ecosystem approach from start to finish, essentially. The other is that this represents a great deal of, again, partnerships across multiple institutions. You see there the SAMRC together with other science institutions, with other universities, as well as more rural institutions such as RE. And that is speaking to both TB, HIV, but then all the way to supplemental programs as well, and linked together, of course, with the WHO and the medicines patent pool. This is our capacity development program funded by CSSF. And you can see here again, there's studentships, there's scholarships, as well as supporting programs. And this is in collaboration with the National Department of Health, but then also our private partner or NGO partner, the Chen Sang Seong Family Foundation. And here also our NMU medical student support, really important for capacity development at universities that are not research intensive and are growing their research intensive space. This is KFW DSTI Infrastructure Support Program, which addresses the gaps and strengthens infrastructure for vaccine research, development, preclinical testing, pilot scale production and regulation in South Africa. This was launched sort of in June 2024. Several awards were made. Procurement is currently in progress, and this represents a very exciting new development. This again speaking to the entire vaccine ecosystem and the entire value chain, but really wanting to show all of the various partnerships, all of the various relationships, and how we intersect with the different universities and the different elements as you go all the way from genomics to commercialization. So just a couple of other programs and strategic projects that I wanted to highlight. The first one here is the International Strategic Partnership with UKRI. Several awards made there, but really important, representing a slightly different area of interest, which is now becoming one of the top causes of mortality in our country, NCDs, multimorbidity and One Health. On the right is the SAMRC ANRS partnership focusing on TB research collaborations in multiple priority areas. Also a very nice collaboration with our Department of Health as well as DSTI. Here we have our AMR drug discovery program. We know that AMR is fast becoming a major area of concern for health research. And this really builds on those hubs, and 3 awards were made in April of this year. And then, of course, MPOX is one of the areas that is more recent in our history, but it's a very good example of how the SAMRC was able to use the learnings from COVID-19 to rapidly respond to MPOX research. And you can see there the awards were across from vaccines, diagnostics, surveillance, and therapeutics. Some other awards, programs, and strategic projects. One with the NIH, this is for collaborative biomedical research. One with Japan around the genomic insights for the pathogenesis of cancer and other infectious diseases. Healthy is a very interesting collaboration with Canada, China, India, and of course South Africa. And this is looking at a package of interventions in a Soweto-based cohort from preconception all the way to early childhood. And then I want to highlight the program under IKS. This is looking at strategic projects to test product development pathways now towards clinical trials. And you can see those outlined there, and really an important part of the work we do. This is another important area in terms of the SAMRC. There's strategic convening power to feed into Department of Health and our government's various strategies. This is around the National Cancer Research and Innovation Strategy, NCRIS. This is funded by DSTI and a very close collaboration between the University of Pretoria and the SAMRC. This photograph is from the convening meeting here at the SAMRC in Cape Town, but this was followed by 4 subsequent meetings in each of the areas. The last one was done in Limpopo, bringing together government, academia, science council, lived experience, and civil society to deliberate on cancer research priorities for South Africa. Just going through some of the self-initiated research grants, we always talk about the fact that many of our A-rated health-related research award winners actually started with a SIR grant. And here you can see our current portfolio, the ethnic background, the gender background, and then also between mid-career or established career and early career awards. Our innovation programs includes a technology transfer office, a global health innovation accelerator, the MEDIC program, and then of course the SAMRC Tier Seed Fund. We like to think in ecosystems, so this is our medical device and diagnostics ecosystem, again demonstrating to you the close relationship between SMEs, innovators, universities and science councils, and then of course our industry partners on the right. And then we've mentioned before some of our strategic research initiatives. I've just highlighted these here for you. GOD-P, the Global Antibiotic Research and Development Partnership, many work partnerships with BRICS colleagues, and then EDCTP, we have a hosting agreement with the SAMRC, EDCTP, but we actually work very closely with EDCTP, and many of our projects are funded by EDCTP as well. Part C, I'm going to move on to our performance information. And so this is a report from the Auditor General in terms of our clean audit. And here I'm going to go through this quite rapidly. I do realize that the font is quite small for the committee members to read, but I'm sure they are able to do so. Of course, I want to highlight across the top our first and sometimes most important as a parastatal to administer health research effectively and efficiently, and that you see over the last period a clean audit was achieved. The percentage of baseline budget, 19.5%. So in the last two columns, we've highlighted there the performance target, and then on the right, the actual performance. And so in this first slide, you can see that in all of the areas, we have achieved our performance target or even exceeded it. And when we've exceeded it, sometimes we've exceeded it quite significantly. I want to highlight in particular there the acceptance or acknowledgements of our SAMRC grant holders, acknowledging the work that the SAMRC has done in terms of funding their particular outputs. Here, when we look at human capacity as well as translation of new knowledge, again, I draw your attention to the last two columns where you can see performance target and then actual performance. I'm sure you note that when we look at point 4, awards to MSc, PhD, postdocs and early career scientists from historically disadvantaged institutions, you will see that our performance target was 83, our actual performance was 71, but I also draw your attention to the previous year where our actual performance was 60, so we have certainly improved significantly by 11 compared to the previous year. But I also remind you of the previous slides where we showed some of the intentional capacity development that has gone into historically disadvantaged institutions, and we anticipate that those awards will improve as the work that has gone into capacity development will start to pay off. Again, another thing that I'd like to draw your attention to is 5.1, which is the policies, reports and guidelines referencing SAMRC research. You can see we far exceeded the target there, and that actually speaks to the fact that knowledge translation and knowledge dissemination and evidence-based guidelines and reports have become very important to the MRC, and we've really focused on that both within the MRC intramural units and platforms, as well as the extramural units and platforms, because it speaks to the research actually having profound impact in terms of outputs. Financial information, I'm going to leave this one for you to have a look at in terms of the surplus for the year. The numbers are there, but I'm going to rather focus on this one where we look at areas where the income has either increased or expenses has decreased. So you can see the baseline grant increased by 9.65%. Contract income decreased by a very small margin, 0.3%, given the tumultuous last year in terms of contract income. I'm sure people can understand that and are reassured by the fact that the change is fairly low. Rental income decreased by 3%. Investment income decreased by 13.4%. But the value of new research grants awarded was 678 million. On the right-hand side, you see the expenses that decreased in total by 1%. And here are some of the ones listed, so you can see the particular breakdown of that. Our CFO is with us today, and I'm sure he would be very happy to answer any questions in the regard. Here just some trend analyses to show what's happened with revenue and expenditure over the last 5 years. They normally track each other very closely, and this year there's just a slight deviance there. Our revenue growth, you can see there was a baseline growth exceeded our research contract funding in 2020 and are now tracking each other much more closely. And across the bottom in the grey is other income. We look at our baseline grant trends. This again over the last 5-6 years. You can see that the numbers are very similar, but in 2022 and 23, the years, it was a significant drop. 2020 and 2021 was obviously the time of COVID as well. I'm going to move on now in our final part of the presentation to stakeholder engagement and social responsibility, something we take very seriously. I remind you of one of our values being citizenship. We believed in engaged scholarship and engaged citizenship. And so our corporate team are very involved, as are all of the SAMRC employees in terms of social responsibility and campaigns. We have a football club that work very hard, not only on the field, but off the field as well in terms of community engagement. You can see some of the activities here. This was the health awareness walk last year in Cape Town. We also replicated that in the other centers. Here, speaking to the Nelson Mandela Jar of Hope initiative, also at all of our centers. We feel very strongly about growing scientists right from school-going age. This is our Gen S, or our Gen Science job shadowing program, which we do in all of our centers, and also support these learners when they come to our job shadowing in terms of personal growth and development while they're here. Our digital platforms are exceptionally active, and you can see some of the numbers there. For example, in our website, 88 million hits just over the last financial year, which means that people are actively looking at our website, but also using the resources that is embedded within our website for their own academic and career growth. And so I want to end there. I really appreciated the opportunity, as does all of the members of the SAMRC, to present. And we end with the art of science. You may see very interesting picture on your right, which is a confocal microscope image of a cell, and then of course DNA to remind us that science is an art, and we always see the beauty in what we do. So I'm going to stop there, and thank you very much, Honourable Chairperson. I appreciate the opportunity, and hand back over to you. Thank you.
Thank you very much. Did you introduce yourself as a Vice President of the Medical Research Council?
That is correct, Chair. I am the Vice President. My name is Liesel Tuka, and I am presenting today as our President is unable to join us today. Thank you very much.
Thank you. Thank you very much. Thank you very much. That was wow. Honorable members, there's the presentation. Let me put an apology before you start, honorable members, to say I know you are programmed in having your lunch by 1 o'clock. My apologies for that, but the planning was such that we will break at 2. My apologies for that, honorable members. But let's start coming up to have a bite on the presentations. As we recognize you as you come. Are you on my side, Vuyo, to assist?
Yes, Chair. The first one is Ms. Shabangu, followed by Ms. Clark, Mr. Van Staden, Dr. Leroux, Ms. Kumalo, Dr. Litlape, and Mr. Mutubatsi. Thank you, Chair.
Okay. Ms. Shabangu, Honorable Shabangu, can you take the platform?
Thank you, Chair, and thank you for the presentation. I'm trying to select on my questions because now I had, but let me just put them anyhow. I want to check with this entity because I saw on the report that the transformation within this entity is still lacking from the report that was presented here. Maybe first I must start by appreciating that when you look at the gender, there has been an improvement. If you look at women, if it is a female gender versus male, that there is some transformation there. But I think 2025, then it becomes 50-50. I don't know how that happened, but I saw that it's like that. But then why I'm saying that the transformation is still lacking, it's because one still see the low representation of the previously disadvantaged groups. Look at your Kalaks and Indian in those presentations, they're still in a very small percentage. So one would be interested to hear from this entity, how is it going to improve on the transformation? My other concern, Chairperson, I would appreciate if the entity, this Medical Research Council, can indicate if they do have people with disability as employees, either on a junior or senior level, because I want to believe that there are soft skills. It's not about they can't find disabled people. I'm also coming from the point of we are looking at all the departments, including these entities, including private sectors, to improve on the employment of people with disabilities. So I would appreciate that if the entities look at the employees, we need to see the percentage of people with disabilities because they also need to be employed. They're in large numbers and most of them are educated, but I don't see that in this presentation. Hence, coupled with the the previous disadvantaged groups, I'm emphasizing the point of transformation is still lacking, and I would appreciate if this council will look into that. Another question is, I'm trying to select so that I don't take long. Okay, so I spoke about transformation because I wanted to check with them, how are they advancing their transformation strategy in leadership research programs to reflect on the national equity goals. It's important, it's across the board, private, government, departments, all that, we're looking at it. And on the, oh gosh, Chair, forgive me, I'm looking at, then another question that I wanted to check, how do you measure the impact of your research programs in relation to public health outcome? The research programs that you have, how do you ensure that they are impactful on the public health outcome? And another question is, I wanted to check with the council, what strategies are in place to diversify funding sources and reduce reliance on the government allocation? Checking on that because I know that they also look at those, they do get some fundings. And the last one, Chair, is how are this entity is balancing the limited funding against growing demand for research, because there is a growing demand for research. So how are they balancing that? Thank you, Chair. I hope my colleagues will cover me on other questions that I didn't ask. Thank you.
Noted, Honorable Shabangu. Honorable Clerk, you are the next.
Thank you, Chairperson, and thank you to the SAMRC for their presentation. It's always a pleasure to listen to them when they come and present to us, and congratulations on your audit, because that's a very good achievement. That's what we want to see in all our entities. Okay, so my questions are, what is the current under 5 mortality rate per 1,000 live births? And what are the 5 highest causes of death? What research has the SAMRC doing in terms of addressing malnutrition, which has now become a huge problem in our country, particularly in children under 5 years? And what was the legal service of 217,000 needed for? Then please provide the adequate reason for identifying some targets as new, while they have been reported on in prior years of 2020 and 2021. And then the entity, if they could please explain the rationale for overachieving its targets, and then the plan to increase targets to maximize health outcomes. Thank you very much.
Thank you, Honorable Clerk. Honorable Van Staden, can you take the platform?
Thank you, Chairperson, and thank you to the Council for your report. It's much appreciated. I have 2 questions. Please correct me if I'm wrong, but as I understand, there's a high rate of resignations out of this SAMRC. I just want to know what is the reason for that. That's question number 1. And my second question is, I also understand, and correct me also if I'm wrong, that there's a very high rate of expiry contracts in the council. I just want to know what interventions have you put in place to rectify the expiring of contracts, but he's currently also at a very high rate. I think it's 35.3%, if I understand it correctly. That's all for me. Thank you, Chairperson.
Noted, Honorable Van Staden. I come to you, Dr. Leroux.
Yeah, thank you, Chairperson. Thank you very much to the MRC for your report and for the good work that you do. I just wanted to perhaps just ask, in terms of the funding gap that's been left with the new administration in the United States, I know that money's been lost for some studies funded by PEPFAR and by the CDC. Could you give us an indication of how much that involves and which projects specifically have been affected by these funding cuts? And I know that there has been some money been made available by government. If you could just give us an indication about what amount that is and how much you are still short on those projects and how you're managing those. I think the second question is just around your focus on social justice and social impacting on our social fabric of society, which I think, of course, is very important. But I think that there's also, and we've seen this happening both on the left side of the political spectrum and on the right side of the political spectrum, there is more and more influence on research from political influence. And just to ask, how are you guarding against that? I think that there's certainly poor research being done that is ideologically being driven, and how do you ensure that you that you don't allow for ideological perspectives to influence the research that is being done? Thank you very much.
Thank you, Dr. Leroux. Come, Honorable Khumalo.
Thank you very much, Chairperson. Chair, let me also join honorable members for welcoming and appreciating the presentation from SAMRC. Chairperson, I'm just having two questions that I want to pose. One is, SAMRC navigates the impact of the US funding withdrawal. How does it determine which staff and research programs in highly affected units will be sustained or downsized? Lastly, Chair, to what extent has the SAMRC stress tested its ability to maintain core research functions under different funding cut scenarios? Thank you, Chair.
Thank you, Honorable Khumalo. Dr. Letlape.
Thank you, Chair. Just proof of life.
Which we appreciate.
Thank you for the presentation. My questions are about in relation to research funding, what is being done, because there are challenges about government contributions. But related to that, there's issues about access to products of research to communities and the issue of pricing. I mean, there was a debacle about how much government funding went into research related to COVID vaccines and what should the price points be to improve access. So just a comment as to how the MRC looks at that and how you're going to mobilize that South African governments contribute more to research.
Thank you, Dr. Letlape. Whoever was after you, it's your turn, Honorable Member.
No, thanks. Thanks very much, Chair.
Thank you.
Just proof of life. Thanks very much. I think I want to join colleagues in appreciating the marvelous report. It's music in my ears, the way it was presented. Just one on the retention strategy. If you can just take us through on the retention strategy so that we don't lose the cohort of people who are in the, how do you have any strategy? Secondly, I'm going to harp on last year when you appeared before us. Sometime I raised the question of indigenous medicine, which is close to my heart for various reasons. In particular, that we need to deal with this particular aspect so that we preserve our own identity as Africans. The response that we received was that there's a project that is being done with CSIR. I just want to check the update on that project, or was there any communication in that regard to lift that particular project so that it can at least find expression in our work, or in the work of the entity as it does that work, because that has got an impact on what I raised earlier on SAHPRA. If maybe we can get an update on that, if it does exist, and if it doesn't, what work are they intending to do as an institute to help us around this particular matter of preserving our indigenous medicine? Because like they say, science is art, and science in itself is knowledge amassed and practiced over time. And we know for sure that there are these herbs that exist in our society, but how do we then preserve them, and how do we use them effectively to respond to the challenges that face the society within the health sector? Thanks, Chairperson.
Greetings.
Thank you very much. Anyone that I'm leaving, Honorable
Chair.
Yes, Chair.
I note.
All right. I thank you, Chairperson, for the opportunity, and greetings to SAMRC as well. I just have a few questions, Chair. Please, if you can provide me grace if I take slightly a bit longer, I'll try to rush through on them, because the SAMRC, I think, is a peculiar entity, noting, the historical legacy or apartheid legacy. It requires us to zone in much more on issues of addressing historical inequities. So I want to find out from SAMRC which specific programs they've implemented, maybe since 2020, to redress apartheid-era health research inequities, and what measurable outcomes have improved access for marginalized communities. We want to find out how is SAMRC ensuring that its leadership and research priorities reflect South Africa's diverse population. And secondly, on their data, not necessarily in this presentation, but their data highlights that only 5 of 696 health facilities were meeting 80% performance standards in 2024. So we also want to find out how they are collaborating with the Department of Health to address critical shortages in staff, equipment, and drugs, and what policy recommendations that they've submitted to Parliament to strengthen the public healthcare system. On the first question, just to expand a bit on the first question, in relation to the context of the apartheid legacy and the issues with representation and all of that, there's many critical health issues that are not being researched adequately, and the information found from that research being mainstreamed in the public healthcare sector. I'll give an example with the issue of pain and Black women and obstetric violence, right? So I'm asking in relation to those kinds of issues. And then number 3, it's post-COVID, and we see from your research that many survivors post the COVID-19 era, there's been a strong rise in mental health issues. So we want to find out what urgent interventions that the SAMRC has recommended to Parliament to address this growing crisis in the public sector. And in relation to that as well, post-COVID, there's been a rise also in vaccine hesitancy. I think the SAMRC will agree. And we want to find out, you know, what interventions they are doing, you know, to build public trust and confidence, especially in marginalized communities. How are you addressing social media criticisms? How are you addressing the perceived disconnect that you guys supposedly had from grassroots health needs? And what are your outreach metrics that you can share with us? And on accountability and collaboration, we want to find out how SAMRC is engaging with communities and civil society to ensure that their research output is in alignment with public needs. And please do provide examples of such successful partnerships. And yes, thank you so much. Oh, lastly, Chairperson, I'm sorry. Lastly, on oversight mechanisms, how do you ensure research integrity in addressing public concerns about ethical breaches or trial transparency? I think this is important in ensuring that conversations with SAMRC also inculcate, you know, a parliamentary lens on focusing on policy impact, on public interest and systemic change. Thank you so much.
Is there any honorable member that I'm leaving behind, members?
Chair, I wasn't left behind, but I was disconnected.
Sorry for that, Dr. Ditlape. You can take the platform again.
Yeah, it goes to what Honorable Chirampongos has been talking about, the issue about research protocols, evidence versus opinions of researchers. And, you know, you see a lot of people that do surveys, and the survey is indicating something different, and they then speak about in their opinion. How do we ensure that research and pronouncement are based on research outcomes? Can we tighten up in terms of research protocols and seeing that people don't do research with a predetermined outcome? And more importantly, how is the MRC going to deal with disputes on different opinions? How do we ensure that there's a civil way where the research community can come up with how they deal with minority views or different opinions, so that we don't have this confusion in the public opinion? And during the COVID, some of us were concerned about choice being taken from public members and the issue of vaccine mandates that seem to have been supported by some of those that were in the MRC, where choice of people is being taken away. And lastly, the evidence, research, and support for non-pharmaceutical methods. If you look at something like infectious diseases, COVID, there seems to be an over-reliance on finding an injection for everything. And non-pharmaceutical methods, behavioral issues, social issues that are not under the control of pharma. For example, track and trace solutions, isolations, preparedness in terms of facilities, so that with infectious diseases that you can stop the spread. There seems to be very little written about around those issues and research, so that we prepared. So we don't have to spend billions and billions on temporary hospitals, which just turn out to be a waste of money. And I hope I was audible when I was talking about the challenges of people with disabilities, mental health issues, and poor leadership. Thank you, Chair.
Thank you, Dr. Ditlape. Coming to you, Medical Research Council, I have something to raise, starting by acknowledging and commending you on the maintenance of your clean audit. But I note that in the year under review, there is some 47,420, if I'm correct, that is confirmed as fruitless and wasteful expenditure. Can you provide breakdown for such incident that gave rise to that cost? Also, on the issue of your scholarships, I have seen your pie chart that you presented. You have started to address those that were previously disadvantaged, meaning the Africans. But I would be pleased if you can include the group that was mentioned by Honorable Shabangu. If you don't have those those posts that require some soft skills to cover those that live with disability, you may target them when you identify those that you are to provide scholarship to, so that you skill them and then you have them at last. And also on your, how do you as a council demonstrate your successes? Do you have any platform that you use so that even these ones that need to apply to your scholarships are able to get that information? How do you share your success stories as a council? Also, we understand you are not a profit-making organization, but is there a social responsibility program that you are involved in? And I will close my question session by checking if I'm correct to say you are faced with 2 High Court claims by research trial participants. And while we appreciate whatever that you do as a council, but can you talk on that? Can you confirm that or dismiss that? And also respond and give us an update to that effect, so as to minimize future risks of participants' legal claims and associated liabilities. If you can just respond to that, we can be very pleased as this platform. Thank you. Over to you.
Thank you very much, Honourable Chairperson and Honourable members of the Portfolio Committee. Really appreciate those questions and the opportunity to address them. I'm going to have a start on answering the questions, and then I'll hand over to my colleagues in the room for their input as well. So I'm going to start with the first question, which also came up in some of the other honourable members' comments and questions around transformation. And there, probably the 3 areas around transformation was around gender, around ethnicity, and around disability. And I appreciate the acknowledgement of the transformation profile in terms of gender, which is in alignment with the research system rather than, for example, with the academic system, which we see still lagging behind quite dramatically in terms of profile. So 71%, as I've mentioned, is our female gender profile, which is extremely appropriate for the sector. We note the comments around ethnicity in terms of our progress over the last years. We note that, however, that over 80% of our senior management are historically disadvantaged categories: Indian, coloured, and Black African, which we see as a sign of significant transformation. We've only given the last 3-year period, but we have looked at the periods before that. And so for the last 2 years, we've had more than 80% of our senior management team being historically disadvantaged in terms of background. A very important comment is around disability. So the first point I'd like to make there is that we have 2 of our very senior unit directors as people with declared disabilities. And in total, we obviously were not able to give you every one of our statistics, but our target was in our females and males are 13, and we have managed to employ 11 colleagues in the SAMRC that have declared disability. But I think the highlight there to mention is that we have 2 of our senior management team that are declared and significant disability. One of our unit directors as well as one of our deputy directors. Very important point that was raised also by the honourable member was around soft skills. We do not see research into disability as being soft. We feel that it is an incredibly important skill. There is a lot of science around preventing disability as well as within disability. And so we feel very strongly about that. We also feel very strongly about encouraging applications from those with declared and undeclared disability. And in every one of our applications, we note a specific area under the progress to say that we strongly encourage women, people from historically disadvantaged institutions, and those with disabilities to apply. So I hope that answers more than just one of the members' comments there. Thank you very much to Honourable Member Clark. Very interesting questions around under 5 mortality. Our under 5 mortality rate is 34.7 deaths per 1,000 live births. This was from 2023. It is one of our concerns that we are not able to have up-to-date information, live information. That is often under the Department of Statistics. And we have a very close working relationship with the department so that we can have up-to-date mortality as well as morbidity statistics, not only for yourselves, but to be able to work with those. You asked me what the top causes of death are in under 5 mortality. That's diarrhea, pneumonia, malnutrition, infectious disease, and neonatal deaths. And your comment around malnutrition was very well taken, very concerning. You saw that one of our themes is maternal and child health. And so it is something that we work on, but we also encourage our grantees to work in this area. And so it is one of the priority areas in our grant funding mechanisms. What we as the SAMRC do within our internal program is respond very immediately to new and concerning trends. A good example would be the issue of food poisoning at schools. Whenever those kinds of matters happen, we spring into action very rapidly with the appropriate unit or units. And so we have done the same around the issues of malnutrition. The final question there was also around the top causes of mortality in the country. This is also really important. We published a paper in 2020 around the top causes of mortality that was published around 2019, because that is often related to death certificates. We've been working incredibly hard in the SAMRC, in our burden of disease research unit in particular, around the authenticity as well as the robustness of death certification and the impact that has on maternal, on morbidity and mortality estimates. We do feel that the estimates, HIV, TB, cardiovascular disease, cerebrovascular disease, diabetes, and chronic respiratory illnesses is definitely in the top 5, but we also were aware when we did a critical review of death certification that these were sometimes misaligned, and that there could be a difference in those exact numbers, again speaking to the need for an even closer relationship between the Department of Statistics and the SAMRC. There was a question around diversifying funding. I'm going to leave that to our CFO to discuss. And then there was a discussion and a question around how do we balance the demand for funding for research to the actual funds that we have available. And although we are very grateful for our baseline grant, this is clearly not able to match the demand for research funding. We were able to see that very critically this year, and we really value this opportunity to engage with yourself at the Parliamentary Portfolio Committee for Health, because it's around health research and raising the profile of the need to have further funding to be able to address this research need. The way we do that at the moment is by these strategic partnerships where we balance what we are able to provide with what our colleagues and partners and collaborators provide. And because we have a very solid reputation in this regard, often we are matched, not one for one, but sometimes in excess of that, so that we can actually balance the research demands with the funds that we're able to achieve. I'm going to move on to Honourable Member van Staden. He spoke about the research gap, and this has been an excessively stressful year for everybody working in health research in our country for obvious reasons. Started on the 20th of January and certainly hasn't completely gone away with a change in research funding, and we anticipate that this will continue for some while still, not only from the NIH, but some of the other larger funders. It's appropriate that funders also change their own strategy. There's been a new strategic focus area from Wellcome, for example, to Blue Skies research, which is very different to the kind of research that we do. You're asked for the specific loss. We lost the Brilliant study, which was just about to commence during the dissolution of USAID and PEPFAR. That was a $56 million award, and it was a heavy blow to have lost that. However, that program had only just been awarded in December of last year, and so there wasn't a huge fallout in terms of current staffing, for example, on that program. We were able to absorb many of our staff and pivot to other programs. There was some losses, but these were quite small compared to some of our other partner institutions, and we've been able to recoup and repivot accordingly. Member van Staden also mentioned CDC. The CDC have refunded as well, although the funding is at a different level to prior to the funding cuts. And in the meantime, we've been able to pivot to be able to absorb that. The question from Honourable Member Leroux was around acknowledging our work for social justice and how important that is, and that our research is driven by priority and by the needs of our community, but also understanding that there are also political and ideological perspectives that come into play. This maybe also addresses the comment from Member Chirwa around oversight mechanisms. We have a research integrity office that works tirelessly in this regard. We obviously have our own human ethics committee, and we also sit on the National Health Ethics Committee. And so we are always applying the lens of research integrity. You may or may not know that there was a new guidelines that came out in October of 2024 around all researchers having to undergo research ethics training. I myself underwent that in last week, and every member of the SAMRC involved in research ethics, which includes our support staff as such, will all be trained in research ethics. This, however, does not mitigate for other members of the research ecosystem to be driven by ideological, political perspectives. I acknowledge that, we acknowledge that, but we hope that the work we do and the example that we set goes some way to being able to address that. There was also a question about resignations, and I have the exact number of resignations over the last year. The total number of staff that has left was 68, and I can just give you a breakdown. One sadly passed away. We have had 27 resignations, and that was about 37.7%. 12 actually retired. There was ill health as well as expiry of contracts. That was also another question around the expiry of contracts and why that level was high. And that is often related to the fact that research comes in projects, and sometimes we have a finite project, and that is related to a particular project. We also know that many of these short-term contracts that we're talking about are not SAMRC employees, but that are involved in these projects. But I'll also get our Chief Research Operating Officer to address that particular point. Then there was a question around, funding and price points and how we engage with government. And our CFO will address that from a financial perspective. From a research perspective, we cannot obviously determine price points, but we are actively involved in health economics. We have a unit that looks particularly at that, our Health Systems Research Unit, which in fact work very closely with the Department of Health in many of the other elements that were raised. We have an extramural unit which specifically looks at health economics, as well as another Health Systems Research extramural units. And these are involved in particular around best buys for every rand that we spend on interventions, on diagnostics, and on new programs. And so these units all work very closely with our government to hopefully provide evidence-based advice and policies. There was a question around researchers' opinions and how we are able to ensure that we get a sense of what policies are are evidence-based and based on fact. This is the bread and butter of the SAMRC, but we also have to acknowledge that the situation at the moment for science is probably more challenging than it's ever been before, perhaps just excluding the immediate COVID period. And we have to work very hard to make sure that the evidence that is within the country and within the world is based strongly on evidence. We were all aware of the very disturbing situation last week regarding paracetamol and autism. And it's the kind of messaging that not only through our corporate communications, but through all of our engagement with scientific councils and higher authorities that we try and speak to. There was a question around retention strategies, and I think that was really important. We have multiple programs that speak to this, and this is around things like our STAR program, which is a strategic, targeted, accelerated research program. It's not only for people with the word scientist in their job title, but our entire ecosystem, which includes finance, includes legal, etc. And this is a very strong area that we work in. We work, as you've seen, in intent in terms of our research capacity development within and without the SAMRC and throughout the whole country. And we integrate all of this into all of our programs. So we have multiple programs, especially through our transformation as well as our capacity development arms, to try and retain and also retrain and capacitate both our internal staff as well as all of those that are working with us. I ran out of place on my page, so I may not be doing it in perfect order anymore. There was a question about the issue of engaged scientific citizenship, especially during the time of COVID. This is absolutely the case. We saw that front and center, that much of the COVID community disinformation meant that we as scientists had to be extremely courageous, and we had to speak very strongly to science, to evidence-based medicine and evidence-based policies and priorities. This is not a fight we're going to win easily, but we certainly are addressing it in multiple ways. So I can speak to some of our programs in this area. We have been working, for example, through our Cochrane unit to provide plain language summaries of data. We work with our community and our corporate partners to be able to ensure that we provide health information that is robust and comprehensive and data-based. But to do this at community level, so using, for example, community radio, our community engagement strategies, and all of this is to ensure that we are evidence-based. Then there was a question around what happened in terms of the federal funding cuts and how we addressed those. I'm sure all of you will remember that the SAMRC played a leading role in getting a very strong commitment from Treasury of 400 million over the next 3 years, matched by international funders, to be able to fill the research gap. We were able to assess over 104 applications within 4 days, and then have these processed and out to the researchers within a month to be able to do that. We actually feel that this was a real win for the research ecosystem in our country. It also brought to everybody's attention the fact that we need more research funding, but we also need resilient research funding and funding that is owned, not only the research, the money itself, but as Honourable Member Leroux mentioned, that is not driven by political ideologies from within the country or from out of the country. So at the moment, in terms of our core research, we are fully operational. We have had to pivot in some regards to be able to deal with, for example, the loss of the Brilliant Fund. We are able to support our researchers from across the country for them to continue their research. And I think we've also encouraged, for example, some of the research intensive universities to put some of their own funding into their projects and support their researchers. There was a question about non-pharmacological methods and knowledge translation in this area. And we believe very firmly, once again, in evidence-based interventions, as well as in understanding what we mean these days by pandemic preparedness and responsiveness. We're involved in multiple programs in that regard. We are involved in the structure of early warning systems. We involved in programs like GLOPIN. We involved in IP3, which is funded by the NRF and the Department of Science, Technology and Innovation. And we are involved in the pandemic treaty together with the WHO. And so we are looking at non-pharmacological interventions, but ensuring that at all times we do so in an evidence and a scientific way. I then get to the comments from Honourable Member Chirwa. You asked about programs for marginalized communities, the diverse population that we serve, and you mentioned some very good examples. And we had a very interesting and engaging discussion, for example, specifically around cancer and how we look at cancer through that particular lens, so that cancer is seen not as the primary drivers of cancer from the global north, but from our particular communities and how our particular communities would like that process to land. So this is really underpinning all that we do. And so we look at various types of research to ensure that our communities are involved. Another very good example of that is our program that is around intergenerational violence for and gender-based violence. And there we have led the forefront in this regard with multiple appearances in Parliament to speak to be part of policy and prioritization briefs and to give advice to our colleagues in the Department of Health, Department of Education, and Department of Justice around this particular area. We're involved in a national health care priorities program at the moment. We had an exceptionally good meeting about that a couple of weeks ago that was housed in our health systems research unit. We had members there such as Dr. Pillay, Anban Pillay from the Department of Health, Claudina Lourdes from DSTI, Nicholas Crisp from NHI, so that we can actually work together with these partners to ensure that the programs that are put into place are underpinned by science and that there is a bilateral agreement in terms of the way we do that. And so I'm addressing that second point also, that our collaboration with the Department of Health, we feel is very strong, but we also feel that it is bidirectional. And so that we look at the Department of Health priorities as we do our priority setting, but they also look to us for the evidence that they need for particular programs. And that speaks to the drugs, it speaks to the population and all of the areas that were mentioned. The next comment was around mental health and well-being. I'm very happy to hear that and to speak to that. We have a mental health, alcohol systems, substance abuse and tobacco research unit, which has led this in the forefront. And a particular program that I would like to mention there is around mental health and well-being of adolescents, often missed in the mortality estimate for children and then for adults. An absolutely crucial area. And here our unit director is actually leading this program and leading it not only in the country but in a global program as well, which certainly I hope will bear fruit in that area. We also walk the talk, and so mental health and well-being is also a crucial part of our retention strategy in terms of the people that we work with. And so there are multiple programs, lunch seminars. We're having a mental health awareness walk tomorrow up Table Mountain, just from the Cape Town group, but we know that's happening in other groups as well. And so it is, again, one of the core areas in which we are working. I've talked about community outreach. I can speak to some of our metrics in terms of that. I think the 88 million hits just on our website is one of those. The exact numbers I would have to get from our corporate communications team in terms of, for example, the outreach to the community radio stations or the community advisory boards that we have in every one of our research programs. But engaging community is a critical part, and ensuring that we have public trust. Just to add to that, we also don't just do programs or intervention, we actually just research this area as well. And so we have our community liaison officer based in KwaZulu-Natal. Actually, there are more than one of them that are actually engaging specifically in terms of their own PhDs in how to do this and how we will then do learnings from that going forward. You also saw in the cancer research strategy photograph people with lived experience, civil society, and a very close partnership there. And I talked about the oversight mechanisms. Before I hand over to my two colleagues, who I'm sure would like to add further, I'm just going to comment on the High Court cases. Yes, there are significant litigation matters, and they do have substantial implications. But I'm sure you are aware that we're not able to discuss this on an open platform in significant detail. Our legal counsel is always keeps us in closely updated on what is happening. We have medical insurance and always mindful of the liabilities related to this, but I can assure the Parliamentary Portfolio Committee that we are working in this area. These are 3 cases that are not related to current research projects, I may just say, but are quite far in the, they've taken quite some time to get to us. And relates. I got assurance from my colleague that I am allowed to at least say this. I wasn't so sure of that, but it does relate to claims from the COVID period. And I think that's as far as I'm allowed to go on an open platform. I'm going to apologize if I've neglected to answer every question in detail. I'm happy to take a second round, but before I do so, I'm going to hand over to our CFO first to address some of the funding questions, and then to our CROO through for any other further questions before I hand back to you. Sibu, over to you, please. Thank you very much.
Thanks, Prof. Zulke. Thanks, Chairperson of the Portfolio Committee and the members. I think I will be addressing three questions. One from Honorable Shabango regarding the diversification of funding and balancing the need for funding versus the growing need. There was also one question on legal services from Honorable Clark. And as well, the last question that I will be addressing will be from the Honorable Chair of the Portfolio Committee regarding the fruitless and wasteful expenditure that we reported in our annual financial statements for the year ended 31st of March 2025. Chairperson, regarding the question from Honorable Shabangu, there are three revenue sources for SAMRC, and those are the baseline funding from National Treasury, and there is also what we call external research funding or contract funding, and as well as other income. The other income category will comprise of the rentals that we do derive from our properties that we're always looking to rent out to outsiders so as to be able to generate income, and as well to investment returns that we earn from our cash balances. Those are the three revenue sources, and it is difficult to diversify any further, given that we are a Schedule 3A entity as defined by the PFMA, which means that the resources that we have, if we're unable to diversify any further, we must make the most of what we have, and making the most out of it, we try and do at all times. As was depicted by Prof. Zulke in one of the slides, over the past 5 years, we've managed in compliance with PFMA Section 53, subsection 3, which requires that any entity of the state or any public entity that will budget for a deficit must do so with the permission of National Treasury. So over the past 5-year period, we have managed, we didn't request any budgeting at a deficit. We were able to budget at a zero and actually perform a surplus and perform where we achieve a zero deficit or zero surplus. And other years we've managed to score surpluses, as evidenced by this last financial year, where we did close with a surplus of 60.1 million rand. In the years where we have a deficit, I think specifically the previous year, 2023-24, we financed that deficit out of our own cash reserves. We didn't have to go back to the National Treasury. And once more, it evidenced the fact that we are able to live within our means. And basically, to just touch high level, the reasons why we had a deficit in the 23-24 financial year, it was due to the fact that there were budget cuts that were announced by 31st of August 2023, and that meant that about 36 million rand of what was allocated to MRC, the National Treasury, did not release it back to SAMRC. And also part of the cash reserves that we were carrying from the COVID-19 era, an amount of about 20 million rand, we had to return it back to the national fiscus, as there was no work related to COVID we were doing by the 23-24 financial year. We did request to redirect it to other needs of the company. However, based on a legal opinion that National Treasury took, they were of the view that they could not allow us to do so. So basically, all what we do, we make the best of what we have of our resources to live within our means. Over the 5-year period that we did illustrate our finances, you will note that we are still 3 percentage points lower than the allocation that we got in financial year 2021, which was 743 million rand. In the latest year, 24-25, we're still lower at 724 million rand. But we are able to still be able to produce a surplus. Thanks. I hope that one is addressed the question of finance management. Moving to the question of Honorable Clark, legal services. The legal services that we incur that resulted in the irregular expenditure were related to an intervention that was just around employee relations, the manner in which we procured those services, it was an irregular, and again, through to the nature of our systems of internal control, we managed to pick that up and flag it with flag it with the Auditor General, and we're able again to investigate the matter. We have investigated the matter. We're in a process of meting out consequent management. And once more, again, an attestation of how well we are managing our finances. We managed to get a clean audit report, even under that environment. The last question from the Honorable Chair, Taigo, regarding the 44,000 Rand incurred for fruitless and wasteful expenditure. That relates, firstly, I must mention to the fact that the amount was incurred and the amount was fully recovered from all the employees who had incurred it. Largely, it would have been interest that would have been incurred due to late payments, where we were able to challenge the suppliers who would have levied that interest, and then they reversed it. But the big part of it was related to employees who were traveling on company business, however, extended their stay, and then we were able to recover the full 40,000 Rand. The other bit of it was related to speed fines, where employees will be driving a company car, and then there are speed fines, and those ones were fully recovered. And all of that amount was fully recovered from the employees who incurred it. And as per the National Treasury instruction, we request condonation of the board once that has been done, and the amount will condoned only after having been recovered and reported. Thanks, Chair. I will hand over back to Prof. Zulke.
Thank you very much, Sue. I'm going to hand over to Dr. Ndluli. There was a particular question about the performance targets and anything else that you feel I neglected to give a full answer to. Over to you, Dr. Ndluli. Thank you.
Thank you, Prof. Zulke, and good afternoon, Chair and honorable members. I'll firstly start with the question around by Honorable Shabangu around the how do we measure research programs with research to public health interest. So, honorable member, what our research is determined by National Health Act, which makes for implementation of the National Health Research Committee, and this National Health Research Committee will then set the research priorities for the country. It is a multi-stakeholder engagement where different areas of research needs for the country are determined, and this is where we would then take our guide in terms of determining our strategic plan as well as our annual performance plan. So, honorable members, you would see in our annual performance plan as well as strategic plan, we do make mention of the National Health Research Committee's priorities. And then there was a question around the rationale for overachieving the targets. So this is the question that we've been answering to the board on several occasions. We did indicate to the board that around 2021, we did get a bit of a windfall from government in terms of undertaking the COVID research. It was around about to the tune of 400 million. And as you know, the research takes a little bit of time and the results tend to come over time. So we've seen the overachievements of targets due to the increase in research funding that we equally distributed to different entities, including intra and extramural research units to undertake research our own or on our behalf. However, having seen those targets and doing the projections in terms of the medium-term economic framework, we subsequently amended our targets for the new strategic plan 2025 to 2030, and equally so for annual performance plan 2025-2026. And this is what we presented to the Portfolio Committee on Health on the 22nd of April this year in terms of our strategic plan and the annual performance plan. And then there was a question around the how do we make sure that we retain and do not lose a cohort of staff? in order to attain our mandate, our HR department and the Executive Management Committee undertook a task of setting up a critical and scarce skill list. So we would look at the areas which are quite critical to the organization, but not only on the researchers, but equally so on the support staff. So we do have that list where we make sure that we retain a cohort of staff that are critical for addressing our mandate. Thank you, Patsuke.
Great. Thank you very much for those additional comments, Dr. Mdluli. I just wanted to highlight one particular point that you actually pointed out to me earlier, and I didn't elaborate on that sufficiently. And so this was to Dr. Leklape, who asked about the non-pharmacological intervention. I mentioned the fact that we're involved in early warning systems, but I didn't outline specifically the name of that program. I'm sure you're all aware of our wastewater surveillance program, which was an early warning system for COVID, but has now also been adapted and expanded for use of any other pathogens that we are particularly interested in. So, for example, it was very important to give a sense of what was happening with the measles epidemic, and can also rapidly be brought into action if there are other pandemics that may be needed to have this early warning system. So I just wanted to add that, but I hope we've addressed at least as much as possible all of the questions. And so, Honourable Chairperson, I'm going to hand back to you. Thank you very much.
Thank you very much, Vice President of the Medical Research Council. You have managed to, I was listening throughout, you have managed to respond to what was raised by the honorable members. I was also comforted by the CFO when he mentioned just two words: fully recovered and also consequence management. Those are the words that talk to financial management in an institution. I think, honorable members, this was the last entity to engage before lunch. Let me thank the team for setting aside time, coming to table their annual report in front of us, make their presentation, respond to our questions. Thank you very much. Whenever we need you, whenever we want to ask questions from you, we will do that as members of the portfolio committee. Where you do good, continue doing that. Where you think you have challenges, address those challenges. I thank you very much. I think your strength is also over your planning to have all of you, those that are going to participate, sitting under one roof so that you are able to manage your whatever that is going to come out of the meeting. Thank you very much to your team. Those that were unable to attend the meeting, tell them that you have represented them. Thank you very much. You are released. Thank you.
Thank you very much, Chair. Before we are released, I wonder if I can give the final word to our Honourable Chair of our board, Professor Johnny Mklangu, and just again thank all our other board members for attending. And I would like to hand over to Professor Mklangu to give some closing words on our behalf, with your permission.
Thanks very much.
I permit you to do that. Yes.
Thanks very much, Honourable Chair, Honourable Members of Parliament, fellow SAMRC board members, and the Executive Management Committee of the MRC. I'm aware that I'm standing between you and lunch, but it remains for me to thank you all these intermittent but extremely important interfaces add a lot of value to the work that you have mandated us to do, but more importantly, the work that we account to you for. And I have no doubt that following this particular meeting, we are at your disposal if there are any other questions that you may have that we might not have answered and or miss during this interface. Perhaps just to highlight the importance of this meeting, it is our national resilience and our economic competitiveness that we are actually able to stand before you here and in fact to defend the health security of the country from the health research perspective. And I can assure you that the SAMRC stand ready to serve the country in its scientific capacity to build this engine for innovation and also to advance health in the country with your support. And I think that, in fact, we've made that point in the report that has been presented to you. And we thank you again for interacting with the report and with us and for giving us feedback. And we can only say that we count on your support to make sure that, in fact, the future remains bright for health research in the country. With that, I would like to thank everyone, and back to you, Chair of the Portfolio Committee.
Thank you very much, Board Chair. I think with all what was said, we stand to appreciate your presence in front of us. Continue doing that when you are reprimanded. I think it's that time that one must release you. You are released. Thank you very much.
Thank you.
Thank you very much.
Bye.
Well done.
Honorable members, we were supposed to be on lunch, but at 2. It is now 1 minute after 2:30. Can we take that 29 minutes break so that we are back at 15 hours? That's 3 o'clock. Can we do that, honorable members? Thank you. On the dot, 3 o'clock, honorable members. We are back. As we promised, honorable members, this is the last entity that is going to present. It's Mines and Work Compensation Fund. Welcome to the team. Welcome to the platform with the members of the Portfolio Committee on Health. We are the members. We are with the Administration of Parliament as led by Ms. Vuyokazi Machalamba. There's also members of the public, maybe including a representative from the Department of Health. We are here to listen to your presentation and engage you based on your presentation and on other areas where members can have an interest on. They are free to engage you on that. I think let me give it to you to start with introduction. I know, I don't know whoever will be starting with the introductions, but that person must start presenting. We are giving you not more than 45 minutes. But if you think that 45 minutes is not enough, you must indicate. Maybe you will finish before. If you need extra time, just inform me that you need extra time for your presentation or during your presentation. You are free to make us see you, to make us see whoever is going to present. But at some point, that person who's presenting must switch off the video. But we must first see the person. And after that, when he or she is presenting, he must switch off the video so that he remains connected and audible to the platform. Thank you very much. Welcome to the platform. Over to you. Thank you.
Thanks, Chair, and congratulations on your acting chairing of this committee. We do appreciate that you've had already probably a long 2 days. I don't think we're going to use all 45 minutes, but we'll definitely take it forward. I'm going to switch off my video and go on to screen share mode. And I am Dr. Barry Kisnasamy, the Compensation Commissioner and head of this unit. Chair, please advise if it's gone on to screen share mode.
Yes, I hope so. Vuyo, are we correct?
Not yet, Chair.
Not yet.
Okay. Now, Ms. Majalamba.
Not yet, but I think we can proceed because it's visible. Thank you.
Oh, it's visible. Okay.
Yeah.
Did it move to highlights?
No.
No. Chair, what I'm going to do is probably move out of screen sharing and go to, yes, it's, I'll go to a minimized screen. So I do apologize to committee members and this happens sometimes that is this being seen, Ms. Majalamba?
It is visible for me now.
It's now moving.
Okay, thanks. All right. Chair, with your permission, I do apologize. I'll have to start. I'm going to make the screen maximal
So I do apologize. For some reason, the slideshow is not working fully, and then go on. Chair, this is the Mines and Works Compensation Fund, which covers the Medical Bureau for Occupational Diseases and the Compensation Commissioner for Occupational Diseases, and providing the annual report in terms of the last financial year that's being presented to your committee. The good news is that it's audited. Previously, we had problems with not having to supply the annual reports on time to your previous committees. And the Mines and Works Compensation Fund, CCOD and MBOD cover services for workers in mines and works who have occupational lung diseases. So I took it as read that the annual report covers the mission, the vision, etc., and some of the services. And we'd also had an orientation with your committee members last year. And also presented last year. So I'm going to get on with the highlights for the presentation in terms of it. But before the highlights, Chair, just to acknowledge the presence in the room, you did welcome the public, but we have trade unions in the mines and work sector, ex-mine worker associations, the provincial and neighboring country governments that we work with, some of the social protection funds that we work with, pension funds, provident funds, the Shiamiso Trust. So do appreciate and partners internationally that we're working with on some cutting edge scientific research, such as computer aided diagnostic support and services. So just some highlights. Firstly, the Minerals Council has been very important in continuing to support us with financial resources. As you may know, Chair, I've raised before that this is an unfunded mandate of the government of South Africa that essentially had cross-subsidized the mining industry from 1912. But with the support of the Minerals Council, with financial management, information management, outreach services, we've come a long way from a very difficult past. We've approved the actuarial valuation and other social partners, which I'll mention later on, such as Rand Mutual, Shiamiso Trust, Mine Workers Provident Fund, and of course, the provinces and neighboring country governments. We run a plus minus 6 billion rand fund, so actuarial valuation is very important. This gets incorporated into the annual financial statement, and we've had approval of the valuation report from the 31st of March. And very importantly, there are governance committee members here, such as the Risk Committee, the Audit and Risk Committee, and the Advisory Committee as well. And they actually run through some of these reports and approve them. We increased the compensation benefits in terms of the stability of the fund by 20%, which was effective 1st of April last year. And these are the impairment criteria: first degree, about how poorly your lungs are functioning, and second degree. And we have substantially increased the benefits from a very low base. The levies, we've adjusted downwards. These are levies paid by the mining companies, and a reduction of 17%. So notwithstanding the increase in benefits, we've also managed to help in terms of the economic issues facing the mining sector. And of course, we work quite closely with the Shiamiso Trust, Rand Mutual Assurance, and other social protection funds and provincial governments. And we have functioning committees that provide oversight on the work of the Mines and Works Compensation Fund. Very importantly, members might know in terms of past disclaimers, this is the 4th year in a row that we have an unqualified audit opinion. We would have had a clean audit. We had one material finding, which was the settlement of a debt from one of the mining companies. And this was a significant balance sheet item, but this was after we had produced our financial statements as of 31st March, and this happened around about June. But we had to go through a long process because this was an interesting model where we had to seek approval of National Treasury and approval of the Director General prior to settling the debt. But Auditor General felt that this should have been recognized much earlier, but it was outside of our hands in terms of getting the approvals prior to working with the company concerned in terms of settling the debt. In terms of the business processes, we do certification. So there are medical assessments, provision of clinical evaluation of the ex-mine workers, then chest x-rays, lung function tests. These are sent to Johannesburg.
electronically, and I did mention our electronic system that we have in place that's web-based. And Dr. Machali will speak later on, conducts the certifications. And you can see there's a substantive increase in the certifications. Of course, we have a slide later on, which is showing claims finalized, etc. Claims finalized 6,100 compared to 5,000 in the previous financial year. Benefits have increased substantially, partly related to the increase in the amount being paid, but it virtually doubled the amount, 407 million. We collected 105 million through levies. These are what the mining companies pay, and partly reflects some of the closures of mining companies, and notwithstanding the gold price going through the ceiling, I think it was today, it's gone through the $4,000 mark. But there are mines that are still closing in other commodities and things. But overall, with the decrease in levy amounts, this was a low amount. We inspected 131 mines in terms of the financial audit to see that there's no problems in terms of that, and hence a clean bill of health from the Auditor General in terms of revenue collection. And then we've got massive databases. This was raised by your members about our unpaid benefits database, and with linking with Mine Workers Provident Fund, Shemisha Trust, retail outlets, ShopRite Checkers, African Bank, Capitec, patient registration data within the health department, SASA, and not in this financial year, but just in July, we made a major breakthrough thanks to the members reporting. We linked with the IEC. So we do have now a formal link with the voter registration base, and that's provided an amazing footprint in terms of tracking and tracing. We're still battling with Home Affairs, and these are some of the challenges that we might want to raise with the committee in terms of the Home Affairs database. Of course, neighboring countries are still a problem, given that a third of the ex-mine workers come from neighboring countries, particularly Lesotho and Mozambique. But the examples for South Africa are very important of linking databases and pulling together the inputs. And then working with multiple partners, we also make inputs because of the TB in the mining industry, which was a very important issue. We work with BRICS Plus, as you know, originally was BRICS, but I serve as the formal rep of South Africa on the BRICS TB Research Network, and we've given inputs there. Stop TB partnership in Geneva because of TB in the mining sector and the vulnerability of mine workers, and then various international agencies, including the Global Fund and SANAC. And we're grateful that the Vice Chair of the CCM is present, Ms. Mulalo Murudi from COSATU, and she's been very instrumental from COSATU and working with us in terms of work on TB in workers in general, and TB particularly TB HIV interventions. So Global Fund SANAC has been also a very important supporter in terms of TB in mining is now the 5th pillar of the strategic TB plan of the country. And there's substantive resources that will come in through the Global Fund in terms of GC7. Of course, universities, University of British Columbia, University of Cape Town, University of Witwatersrand, and more recently, University Eduardo Mondlane in Mozambique, where we're conducting some major research studies on computer-aided diagnostic tools for TB and silicosis. It's cutting-edge science internationally, particularly for silicosis, working with the Stop TB Partnership. And we implemented the first major field study in rolling out computer-aided diagnostic tools for TB and silicosis in Mozambique in a low resource setting. And we'll continue with that with some of the mining companies who are present at this portfolio committee hearing. And we appreciate the mining companies that have come to the party in terms of trying to pilot proof of concept of the work on ultra-portable X-ray units and computer-aided diagnostic, but with the support of the universities. Of course, Medical Research Council and the TB think tank. We have a functional call center, multilingual, and these are websites which people who have internet access can access, which tells us which inputs in terms of the activities of the MBOD, CCOD, the documents to be filled in. And the more recent input is the xmineworker.com, which is a self-registration portal, multilingual, which takes the ex-mine worker or a claimant through the process And that on a 24-hour basis is automatically feeds back to the mine worker or to our other databases like the mine workers benefit database, etc. And again, we'd like to explore with the portfolio committee members in terms of constituencies that could constituency officers that could actually utilize these databases. This is the certifications over the last 10 years. You can see 2017 was the height. We had a major program that was supported by the Gold Working Group at that stage, prior to the Shiamiso Trust coming into place. So we did major medical assessments and lodgements of claims. Then with the decline over COVID period, and then slowly we've come up to the 2025. And must appreciate the Shiamiso Trust. Dr. Quinda, the Chief Executive Officer, is here, and there may be some trustees. And we work very closely with them in terms of referrals from the Shiamiso Trust to the MBOD CCOD. And these are claims finalized over the last 10 years, and you can see the value in terms of the orange line. It is quite substantive in terms of the value of the payments. As we've stabilized the fund, and it's a going concern, that we've actually done many more payments. So we paid out approximately 2.1 billion rand over the last 10 years compared to approximately 3.5 billion over the last 20 years. So substantive retooling of the MBOD CCOD. This I've raised time and again, the unpaid claims. And as we've stabilized the fund, the key area, Chair, is the issue around dealing with the unpaid claims prior to 2005, about 66,000 of the claims. So we've got about, it's 1.8 billion sitting in Johannesburg, and members had raised, for example, told us to touch base with Home Affairs, IEC. And again, this is still sitting with us that we haven't managed to sort out this backlog. You can see that from 2012, since new management came in, we've reduced the number of unpaid claims. The 21-22 blip is due to the work of the Shiamiso Trust, which is now being slowly whittled down as well. But there's a major issue with deceased claimants, lack of clinical records. Minerals Council is putting together a major program of trying to track clinical records. And we are hoping that your committee chair will pull a meeting between Department of Employment and Labor Portfolio Committee on mineral and petroleum resources, because some of these documents for works is lying with Department of Employment and Labor, and for mines, it's lying, closed mines, it's lying with Department DMPR. So these are some of the issues to try and track claimants, and hopefully with the IEC database, we'll be able to move much faster. The key problem, of course, is neighboring countries and tracking and tracing ex-mine workers in neighboring countries. Challenges. I did write to the previous portfolio committee chair, Dr. Dlomo, about the buildings in Braamfontein, which has not met health and safety standards, and currently we have some contravention notices from the Department of Employment and Labor. Minister has written once before in March to the Minister of Public Works and Infrastructure, and he is in the process of sending a new letter because of the problems of fire escapes and etc. in terms of inputs. And often, because these are public works and infrastructure buildings, there are difficulties in terms of us retooling. And then we used to have decentralized fixed facilities, so-called one-stop service centers, which are not sustainable, and trying to work through how do we actually retool these centers in terms of provision of services, in terms of Batu Pillar principles, closer to people, given that the ex-mine workers actually don't reside in and around Johannesburg, and historically are sitting in places like the Eastern Cape, Northwest, Free State. We also have increasing service requests from provinces and neighboring country governments in terms of activities with ex-mine workers, and we've tried with funding from the Minerals Council South Africa to actually support some of these outreach services. There are colleagues here from the Eastern Cape who are running very successful programs with other funding sources, and the most recently there was a major program with the Department of Defense that actually ran a major program in the Eastern Cape. And these are examples from the bottom up that have actually assisted, notwithstanding Shiamiso Trust funding some of these services for the ex-mine workers. And of course, upskilling of human resources, given that we have a digital platform supported mainly by Rand Mutual in terms of digitization of our records and the claims management system. So human resource management is critical, and you'll see from our human resource tables that the bulk of our staff are actually below level 7 and below. And working with electronic systems is actually a challenge. In terms of the draft bill, just the good news is that we're in final consultations with the state law advisor. The draft bill is called the Compensation for Occupational Diseases in Controlled Mines and Controlled Works. We've also conducted a draft socioeconomic impact assessment. So we're in the final stages within the next 2 days of finalizing documents with state law advisor in terms of the pre-certification of the draft bill. Also then the submission of the socioeconomic impact assessment to Department of Planning, Monitoring and Evaluation for them to also give us a certificate, which we can then begin the cabinet process through the social cluster, FOSAD, Forum of Director Generals, and then the cabinet subcommittee and then cabinet. We are hoping, if this goes according to plan, Chair, that we would publish for comment in the new year, and in terms of the 8th administration, get it to the 7th administration, get it to your committee in the new financial year of Parliament. There was a nominal increase in voted funds, but that does not still cover much of the support we needed, and that's why the voluntary levy support of the Minerals Council is acknowledged. I'm going to hand over through you, Chair, to Mr. Maswangani to discuss the voted funds. This was the cross-subsidy model we talked about of the state funding this. The compensation fund in the Department of Employment and Labour doesn't get any resources from the state. The levies or premiums for that compensation fund is from the for the full administration, healthcare, etc., and the income protection is covered by the levy. But in our case, there is a cross subsidy from the Department of Health from voted funds. Mr. Maswangani, through the chair.
Thank you, Dr. Berry. Good afternoon, Chair, committee members, colleagues, and distinguished guests. My apologies, Chair, that I can't show my face. I have a technical glitch with my webcam. So I'll be presenting the voted funds financial report for 2024-2025 financial year. So under compensation of employees, we allocated a budget of 37.5 million rands, out of which we managed to spend 36 million rands, resulting to 96% spending. So the 4% under spending was due to existing funded vacant posts during the financial year, which we couldn't fill due to the DPSA moratorium on filling vacant posts. So under goods and services, we were allocated 21.9 million rands, out of which we managed to spend 20 million rands, resulting to 92% spending. So the 8% under expenditure there was attributable to the audit fee saving from Auditor General, and as well as non-spending on our budgeted forensic investigation services. That was because by the end of financial year, the procurement process was not finalized. So transfer payments that comprise of 1.8 million rands for payment of monthly pensions, as well as 2.6 million rands for ODIMA Section 74A revenue loss recovery from National Treasury. So all those funds were received, and so we've got 100% there. So under capital expenditure, we were allocated 6.4 million rands, which resulted to a total spending of around 6%. So the underspending there was due to the ongoing procurement processes for contractor equipment, furniture, and other office equipment, for which we couldn't complete the procurement processes at the end of the year, and then it overlapped to the new financial year. So overall, we were allocated a budget, a total budget of 70.5 million rands, out of which we managed to spend 61.1 million rands, which resulted to an overall spending of 87%, resulting to 13% underspending. So the reasons are attributable to what I've just mentioned. So the next slide, it's the voted fund expenditure trend for the 3 years from 2023 financial year up to 2025 financial year. So for 2023 financial year, we spent a total of around 53.2 million rands, coming to 55.4 million rands in 2024 financial year, and then a slight increase to 61.1 million rands in 2025 financial year. So our overall budget that we have been allocated for the current financial year, that is 2025-2026 financial year, is around 70.2 million rands. Yeah, I'll end there. Over to Dr. Berry. Thanks.
Thanks, Chair. That's voted funds, which comes through the departmental budget through the health vote. I'm now going to hand over to Ms. Mama, the Deputy Commissioner, for dealing with the compensation fund. This is the income fund that pays the benefit. Ms. Mama, through the Chair.
Thank you, Dr. Berry. Good afternoon, Honorable Chair. Good afternoon, Honorable members, guests, and colleagues. My name is Thembi Samama, and I'll be presenting the financial statement of Mines and Works Compensation Fund as at 31st March 2025. I will start with the financial performance of the fund as at 31st March 2025, and I will focus on the current year, 2024-2025, starting with the levy income of 107 million, which slightly decreased from the previous year, which was 127 million. And this was driven by the decrease in the levy rate for gold from 5.48 rand to 4.58 rand per wrist shift, and platinum from 70 cents to 46 cents per wrist shift. And these rates are determined and recommended by actuaries. With interest received, we see an increase of 486 million compared to 466 million in 2023-2024. And this was driven by the growth in investments, which was offset by the lower average interest rate. And other income, which is 34 million, relates to a reduction in provision for debt impairment in 2025, driven by the collection of long outstanding debtors and write-offs, which 2.6 million was recovered from state account in terms of Section 74A of Occupational Diseases in Mines and Works Act. And this gives us a total revenue of 629 million. And in terms of total expenses, I will just note the main items, which the first one is the writing of debts, which was done in accordance with the policy of fund as a consequence of the continued data recovery efforts. And key contributors of write-offs relate to the settlement of long outstanding debtors or relating to a write-off for entities that have been closed down. And the second item to note under the total expenses is the provision unwinding cost of 291 million, which is related to the discounting of the liability, and 317 million under movements in provision liability is determined by actuaries who perform the actual valuation of the fund. And this leads us to a deficit of 8.8 million, which is mainly driven by the movement in provisions. Next slide. Thank you, Dr. Berry.
Sorry, Chair, could I just get a point of clarity on that last item? I don't quite understand what that last item was of movement in provision. What does that mean exactly? Because the first time it's come up on your spreadsheet, I'm just trying to understand what it is exactly.
You can please respond to that concern. Presenter?
Sorry, Chair, I didn't get that. I didn't get the question, Honorable Member.
Can you
Thank
repeat yourself, Honorable Leroux?
Thank you, Chair. My question was just related to the movement in provision line item of 317 million. You said it has to do with the actuaries, but I don't quite understand. I see it's the first time that it comes onto the spreadsheet. Could you perhaps go into that and just explain that to us in a bit more clarity, please?
Oh, okay, Member. So we have actuaries that evaluate the fund every year, but from the Act, it will be every 3 years. And so they perform the evaluation and recommend it affects the movement of the provision of the liability. So that increase it's determined by the from the report of the actuaries. I'm not sure if Gert, can you add to
Thank
the
you,
response?
Ms. Mama. Just in terms of the fact that it's the first time, it's been the first time in a while that the liability has actually increased year on year. Hence, the movement that's now reflected in expense. We previously, if you look towards the revenue side, you'll see we had the movement in provision as an income. It's just the first time in a few years that the liability has actually increased, and that mostly relates to the fact that the trust certifications came through to the MBOD, so the claims experience increased over the last financial period, leading to an increase in the actuarial liability of the fund over the long term. Thank you, Ms. Mama.
Thank you, Gert. Are you happy, Honorable Member?
Yes, I think that's clearer. So for clarity, that money has gone to the fund to provide for extra liability cover for the...
Oh, yes.
Is that right? Okay. Okay. Thank you very much.
Thank you. Thank you, Member. And the financial position of the fund as at 31st March 2025, starting with investment, that increased to 5.9 billion in 2024-2025, compared to 5.7 billion in 2023-2024. And this is because of the interest capitalized of 505 million and less the drawn down of investment of 288 million to fund excess claims payments over levies received. And receivables increased to 33 million in 2024-2025 from 50 million in 2023-2024. And this is from a reduction in the provision for debt impairment, which was driven by the collection and settlement of long outstanding debtors. And the short-term provisions are determined by the actuaries, increased by 223 million due to the impact of more permanent degree certifications on our claims experience. And this is because of the collaboration with Siamiso Trust. And the key point to note here, Chair, is that the financial position of the fund is stable with a surplus of 2.8 billion. Thank you, Dr. Perry. Next slide. Going to the financial performance of the Mines and Works Compensation Fund over the MTF period. 3 points to note. The first point is that there are no deficits budgeted for over the MTF period, and current trends expected to continue over the MTF in terms of levy revenue, interest received, and provision for unwinding cost. And also there are no major forecast changes in the provision balance, with the provision to increase in line with the forecasted risk work. Next slide. Thank you, Dr. Berry. The financial position of the Mines and Works Compensation Fund over the MTF period.
And points to note is that the fund is forecasted to remain in a stable financial position with the growth in provisions tracking and the growth in investments. And the last point is provisions are forecast to increase in line with the forecasted risk work performed or carried out over the MTF period. Thank you, Dr. Berry, over to you.
Thanks, Ms. Mama. So we're in a stable position, Chair, in respect of the fund itself. I'm going to quickly run through the performance indicators. This was the first time that the performance of the fund was audited by the Auditor General, and again, a clean bill of health. So in terms of certification, 17,000 against a target of 10,000, and it's reducing next year. Claims finalized 6,197 against a target of 6,000. Benefit payments made 5,637 against target of 5,000. 131 mines and works inspected, and we must applaud Ms. Mampo Baolo and her team in terms of this. This gave us a clean bill of health on revenue. And then levies, 97% recovery of levies, and that led to some of the issues with long outstanding debt, etc. I'm going to quickly ask Dr. Machali to run through the human resources. We are running out of time in terms of the 45-minute by the chairperson. Dr. Machali, you want to quickly run through the human resources?
Thank you. Thanks, Dr. Perry, and good afternoon, members. Good afternoon, Honorable Chair, colleagues, and guests. I will be presenting I'll just give an overview. Thank you. So the tables that are reflected on the presentation talk to the MBOD and CCOD independently, but I'll just summarize both institutions which are under ODIMWA. MBOD being responsible for medical assessments and certifications, and CCOD in essence is responsible for the administration of the fund and payment of compensation. So in the past financial year, we've had 35 vacant posts which could not be filled, and we were only allowed to advertise 2 professional ones, which we did. We had a radiographer and a professional nurse, but they left the system still. So those positions are still vacant. And with the reprioritization process, 9 posts were identified and they were approved by the DG. But still, we could not advertise because of the financial constraints and the moratorium from DPSA. However, this financial year, because of the lifting of the moratoriums on vacant posts. So we've restarted the process, and but it has to be within the budget allocated and for compensation of employees. And we also got a 5 million boost from Treasury, and to help the fund fulfill its mandate and PFMA requirements as a public entity. So that also includes the position of the Chief Financial Officer. All of that is in process. So we have a few key positions that we are engaging with HR that are being recreated, and about 5 positions that existing positions that are going to be advertised. Thanks, Dr. Perry, and thank you, Chair.
So, Chair, just acknowledgement slide of the various political oversight through the Minister, Deputy Minister, and administrative oversight to the DG and the DDGs. MBOD CCOD is very much part of the department as a occupational cluster, and support of the branch health regulation and compliance. Your committee, which has been very supportive of the work that we do, and then the Minerals Council and the various colleagues that have helped us. We work very closely with the trade union federations as well as the trade unions active in the mines and work sector. Ex-mine worker associations, some of them are present here today. The Southern African Mine Workers Association, and we appreciate their support. Rand Mutual Assurance, which gave us a lot of support with the IT systems and digitization of our records. So we now have online platforms because of the support they had given. Shemiso Trust, and of course, Ms. Majalamba and Mr. Joe Cutler, who have always been present in terms of keeping us on the straight and narrow and providing us the necessary inputs in preparation for your committee. Back to the future. Last year I showed the annual report, but this is the Minus Crisis Prevention Committee. Compensation chair is a last resort. Workers don't go to work to get maimed, diseased, or to die, or ultimately fight class action lawsuits that are taking place. In 1911, this was the Minus Crisis Prevention Committee by a previous parliamentary committee that presented its preliminary report that then led to the Minus Crisis Act being set up in 1912. And unfortunately, 113 years later, we still have problems in terms of work-related injuries, diseases, and death. But we must conclude by saying that the mining industry has come to the party. We've had substantive declines in dust levels. The special committee that works program Masoisa has really helped in terms of some of the wellness interventions, the dust reduction interventions, as well as the rates for occupational diseases that have come down. And we must commend them in terms of the process, including new milestones for dust at 0.03 milligrams per cubic meter. So a lot still needs to be done. We still have to get through the unpaid claims section and inputs. There are two additional slides, which is not in your slide pack, Chair, but I just thought I'd input because committee members might be interested. This is the paid claims by location. And basically 3/4 of our claims goes to South Africa. And in terms of the SADC countries, Lesotho takes up the bulk of it at in terms of the funds paid out, then followed by Mozambique, Botswana, Eswatini, and Malawi in terms of the countries in SADC in terms of the payments. In terms of provincial payments, Eastern Cape takes up the bulk. The slide on the left facing you is numbers of payments made, and the payment value, for example, Eastern Cape, 152 million that was paid out in the last financial year. And applauding the Free State, which is also here, and colleagues from Northwest, in terms of work that they've done in terms of the outreach activities. And as you know, one of your members, I'm not too sure if she's here, Lolo, has been very active previously before her time in Parliament in terms of activities on the ground in terms of the process. But these are some of the outreach activities and then the claims paid in terms of this. Chair, I've got 2 minutes to hand back to you. And thank you for allowing us to present the annual report of the Mines and Works Compensation Fund for the last financial year. Over.
Thank you, Dr. Berry. Thank you for such a presentation that was loud and clear. To all those that assisted you in the presentation. Over to you, members of Parliament. Can we note hands for your comments, questions? We note as you come.
The first hand, Chair, is Ms. Clark. Second hand, Dr. Leroux, followed by Ms. Kumalo. And the last one is Ms. Shabangu. Thank you, Chair.
Thank you, Chair.
Okay. Can you take the platform, Honorable Clark?
Thank you very much, Chair. Dr. Kitsami, I know, I've been on this portfolio for quite a lengthy period of time, and I know there's been a serious problem with outstanding claims, and I know you've made some very good strides in dealing with that. I just wanted to ask you what the status quo is of the 72,749 unpaid claims at this stage. And then why is the 2025-26 target for number of finalized claims being revised down from 6,000 to 5,500? And why did the MWCF fail to perform adequate reviews of its annual financial statements as per the AG? Then, what has been made in clearing his historical backlogs of unprocessed claims, and what is the expected timeframe for full clearance? So that really interlinks very much to my first question. And then, what innovative approaches has the fund adopted to track and trace ex-miners to facilitate the payment of unclaimed benefits? And how many active claimants are currently registered, and what percentage have received compensation? Thank you very much.
Noted, Honorable Clerk. Dr. Leroux.
Thank you very much, Chair. Thank you very much for the presentation and for the work that the Mines and Works Compensation group are doing. I just had some questions around the legislation that is coming up. If you could perhaps let us know what the main aim of that legislation is. I also was wondering whether part of that would include being able to use some of the interest, for example, of the fund to actually fund the workings of the fund, so that the fund doesn't have the money doesn't have to come out of the public purse, but can actually be used from the fund itself. So I'm not sure if that is on the cards or whether that's a possibility. But it seems like with such a large fund being available, that some of the interest to be available could be used to run the fund itself rather than putting pressure on the taxpayer. And then, my other question was just related to the AG's report, but my colleague, Dr. Clark, Ms. Clark, has already alluded to that. But if you could just clarify that a little bit more to us, thank you.
Thank you, Dr. Leroux. Ms. Khumalo.
Thank you very much, Chairperson. Afternoon to everyone on the platform. Chairperson, I'm just having two questions. Okay, let me start by welcoming the report. I appreciate it. Chair, my question is that the new risk determination methodology was gazetted in September 2024 with a proposed effective date of the 1st of April 2025. Has this methodology been formally implemented as of the reporting date? And how is the fund communicating the resultant changes in risk ratings and levy calculations to the controlled mines and works? Secondly, given that several members of the advisory committee had zero attendance for meetings, how does the fund ensure that its highest advisory body is functioning effectively and contributing meaningfully to the strategic direction and mandate implementation of the compensation commissioner? Lastly, Chairperson, I want just to check here that how does the beneficiaries of the late ex-miners...
Honorable Member, can you repeat that question? I did not get it myself.
Which one?
The last one that you alluded to.
Okay, given that several members of the advisory committee had zero attendance for meetings, how does the fund ensure that its highest advisory body is functioning effectively and contributing meaningfully to the strategic direction and mandate implementation for the compensation commissioner? That was my second question, Chair. Lastly, Chairperson, I want just to check here about the beneficiaries of the late ex-miners who didn't ever knew that there is this compensation. I want just to check, Chair, how does they benefit from the compensation, ex-miners beneficiaries? Thank you.
Thank you, Honorable Member. If I can add mine, I would like first to appreciate the fact that...
Chair,
all right. Sorry, my
me, Chair.
apologies, Honorable Shabangu. Can you come?
Okay, thank you, Chair. And let me also join my colleagues in welcoming this presentation. Chairperson, there was an issue of a building where the medical bureau for occupational diseases was occupying. It was said to be to be a serious health and safety risk. I just want to check because there is no timelines of this body by the public, by the Department of Public Works and Infrastructure to relocate them from that unsafe building. Just want to check if we can get an answer on that. Then another question is that we are noting the increase fruitless and wasteful expenditure under assessment for possible enormous or double payment to the value of 2 million, which is up from 575 plus minus 575 in the prior year. Can they take us through what are the causes of this substantial increase in payment, and what are the measures that are being implemented to strengthen claims verification processes to reduce the risk going forward? And also, can the fund expand and give a breakdown of the 17.1 million bad debt that was written off? Thank you, Chairperson.
Thank you, Honorable Shabangu. Is there anyone that I'm leaving out?
Dr. Ritlape, Chair.
Yes, Dr. Ritlape.
Thank you, Chair. Mine is more about looking into the future. What are the systems that are put in place to ensure that these problems don't recur going forward? The plight of mine workers is still the same. The working conditions haven't really improved. Job security has not improved. We now have ex-mine workers that have lost their jobs that are continuing with artisanal mining or zamazamas. What are the proactive plans to ensure that we won't be searching for victims, relatives, and we won't be looking for evidence as to whether they acquired these occupational diseases, when, how? Are we using that so that in the future we don't have the challenges that we've had of going to look for beneficiaries, either the miners themselves or their families? What are we doing proactively in terms of regulations, compliance from current mine workers, and compiling a database of the current mine workers? Because their needs are not going to be now. Their needs will be when me and you are gone, Barry. Thank you, Chair.
Any other member that I'm leaving out?
No, Chair.
Oh, yes. Let me come then to say, let me also welcome the stakeholders of the fund, and also including the trade unions that are connected to our meeting, accompanying the delegation of the fund. You see, Doctor, when sometimes it's difficult for me to pronounce your surname, I just call you good doctor. Dr. Berry, you see, I like it when I see that the proposals from this portfolio committee are starting to yield positive results. An example is the recommendation that you must also approach IEC in your tracking and tracing. I'm worried that Home Affairs is giving you problems, but you must continue to engage Home Affairs, because people's lives start there and end there. Because you may have this big amount that is unclaimed. I think you are not necessarily looking for claimants here. You are sometimes looking for beneficiaries it may be that the claimants have long died. So now it's difficult to trace the beneficiaries of those claimants. Also, I wanted to come to the presentation that was led by Dr. Mchali on human resources to get a reason why a person that has been recruited out of the 35, the 2 that were there, and they are reported to have already left the institution. What may be the cause to that? Because it's cost to recruit and time also. So there are resources used to undertake that exercise. Also wanting to check if what was said, what was reported as an intervention from Treasury of an amount like 5 million, does that amount cover the recruitment of the CFO? If it was recruited before the fund, that will be good. But if it is within this fund, its funding, let it be prioritized. It's good for the fund to identify all critical posts so that you are able to, we can join you in making a strong point also to Treasury if those posts are critical. What worries me more before I land is that one uses money to get money. There are people that we normally see in halls in these rural provinces and towns. People flocking in a hall, waiting for someone, some other people politicizing that. There's a lot that is happening, but they will say they have been called to make sure that they get application forms to apply from the fund. So there is a lot that is like that is happening. I think we need to come closer to those situations. I think that was that from my side, but to encourage the fund to continue developing some strategies that will end up having these potential beneficiaries to have what is due to them. We've long been talking about this, but it's very difficult. At least we feel it ourselves, that it's very difficult sometimes to trace an individual, but we must continue. We applaud you in your commitment to make sure that because if you can trace and talk about these are the most previously disadvantaged community members that were working in mines that are not getting their compensation now. Thank you very much. Over to you, Dr. and Tim.
Thanks, Chair and honourable members, for the inputs and having reviewed our inputs. I'm going to start with Honourable Clerk. In terms of the outstanding claims and new strategies, again, appreciated what Chairperson said. We did take up the issue around Home Affairs and IEC. Minerals Council is convening a meeting of all the social protection funds, because while our fund is owing is unpaid 1.8 billion, overall there's in the region of 6 to 8 billion unpaid to ex-mine workers. Chairperson, and essentially what's happened is that there's been vertical programs. Shiamiso Trust goes 1 week to Lesotho. The next week, the Mine Workers Provident Fund goes to Lesotho. The third week, you have the unemployment insurance and compensation, Rand Mutual going to Lesotho, and we all chasing after the same individual mine worker or a beneficiary or a dependent of the mine worker. So the first innovation is one database, one pooled resource base in terms of tracking and tracing, and then for multiple databases. The big problem that we have about the 66,000 from before 2005, Honorable Clerk, is that we are missing documentation, death certificates. If you recall that the difficulties that we had in the past, particularly with what I call euphemistically independent states and self-governing territories in terms of the homeland system, definitely birth and death registers in terms of the neighboring countries and death certificates, and the third aspect has been clinical records. So there are some work that's beginning to happen now in terms of accessing the clinical records, and particularly from closed mines. But a lot of this is what we inherited from past, as Honorable Dr. Letlape has pointed out, the difficulties of past injustices done to this category of workers and inputs on that. So we have some inputs to make, but we haven't been able to shift the dashboard much, the needle much on the dashboard in terms of the numbers prior to 2005. And the new work, particularly to the IEC database and inputs to try and get that. And then the big issue was also traditional marriage certificates, because the dependents, and we needed to work with the Department of Justice in terms of the Master of the High Court documentation. So it is a very difficult process, and we've asked Minerals Council to convene a special workshop for a full day that deals with tracking and tracing unpaid claims and pooling of resources across the different social protection funds. In terms of the performance indicators, so the mining industry has had substantive, and these are current mine workers, and substantive declines in terms of the numbers, and particularly 60% of the submissions to the MBOD for medical assessments and certifications was TB related. The TB rates have come down considerably in the current mining sector, and also the issues that face us related to chronic lung diseases other than tuberculosis, the numbers have declined substantively. So hence, decline firstly demographically in terms of the mining sector, and secondly, clinically and epidemiologically, the numbers have declined considerably, and hence our winding down a bit in terms of the process. Now that's the current mining sector. The ex-mine worker bump has been mainly through the links that we've had with the Shiamiso Trust, and those certifications are being programmed and processed as well in terms of the process. Now, the important point you raised was what is the current number registered with us? Unfortunately, unless we do the outreach activities, it links to Dr. Letlape's point later on about what's the future like, and I'll deal with it in terms of this question from yours and link it to Honorable Dr. Letlape. Is the issue around we don't know the universe. The universe is told to be 1.6 million ex-mine workers, living probably 800,000. But unless we do tracking and tracing, and I think one of the other members had also raised the issue about the chair raised the issue about beneficiaries and dependents in terms of many of the mine workers are deceased, did not know their rights, did not know they were entitled to social protection benefits, including medical examinations, and hence died without a claim. And if they died without a claim, then unfortunately we couldn't pay out the claim. So we don't know the end value, the universe of ex-mine workers, because of the poor keeping of records. And to answer Dr. Letlape's point, we have put in place as of 1st of January next year, the current mine worker force, but unfortunately we only control 350,000, which is under the direct control by the current law, Occupational Disease Mines and Works Act, under the commissioner and the director of the MBOD, where we can get the records of the mine workers. So the 350,000, but there's 500,000 in mining, but we don't control 150,000. These are non-controlled mines and non-controlled works. So it might be something to discuss with the different portfolio committees and the Department of Mineral and Petroleum Resources and Department of Employment and Labor about a universe documentation of all the mine workers. 350,000, we will get the records of the mine worker. the dependents of the mine workers, where they are. And this past week, we intervened in a works that is closing down in terms of getting the medical records and getting the documentation in terms of the current mine workers. So that from the 1st of January will be in place. It's been accepted by the Minerals Council South Africa that we have the right to get this information of the database of the mine workers, the database of the dependents, almost similar to an insurance or a funeral policy where we know the dependents, etc. So that will help in terms of going forward. But Honorable Clerks, about what is the universe, unfortunately, I can't answer that question because of the poor record keeping of the sector in the past. Innovation, I pointed out, would be coming through the process of the Minerals Council convening and multiple databases being merged together with the new database of current mine workers, and then a proper tracking and tracing strategy, which we could present to your committee later on. And if also members of the portfolio committee have got any ideas, we'd welcome the inputs, as I pointed out, constituency officers, etc. On the issue of the review by the Auditor General, this was related to the issue around the post financial statement submission of 31st March and the recovery of debt, which was a substantive amount. But the second issue was they had also asked that internal audit does the review in terms of the process. Unfortunately, internal audit, it doesn't fall under my direct control. It's a co-source function by the Department of Health. So we use the internal audit function of the Department of Health as transversal support. And it's something I've raised with the DDG, and we'll raise DDG Dr. Anbin Pillay and CFO in terms of how do we actually ensure that next year a review is done prior to the submission of the financials. So Auditor General was taken aback in terms of the fact that they felt that we hadn't done the internal review, and that was partly related to the fact that we don't have our own internal audit function. The active claimants, as the numbers come through, then we're giving ourselves a 90-day period. We did report on this in the past. Month one is the medical assessment, medical examination and lodgement. Month two is certification, and month three is payment. And I'm not sure, as far as I know, Honorable Clerk, and I can ask Dr. Machali to intervene, is I don't think we've got a backlog in terms of medical assessments and claimants processed other than through the Shiamiso Trust coming in. Dr. Machali, do you want to quickly talk through the issue about unprocessed claims and backlogs? Because we did clear a substantive number in the 2012, 13, 14, 15 period, where there was about 20,000 claims unprocessed. But in this case, we really have very few. Dr. Machali and...
Thanks, Dr. Perry. We don't have any backlogs. We only have the Tsiamiso claims.
Dr. Machali, if you're there to talk about unprocessed claims.
Can you hear me?
Yes, we can hear you.
Yeah. No, I'm saying we don't have any backlogs. We only have Tsiamiso incoming Tsiamiso trust claims that are in our inbox, ready for processing. But we don't have any backlogs anymore, in as far as the submissions are concerned.
Okay, Dr. Leroux, you're quite correct, and you had raised this before in terms of the issues around the interest of the fund, and we had pointed out that the fund can only pay for the actuarial valuation and bank charges. So you're quite correct. In terms of the legislation, the Mines and Works Compensation Fund at the moment is a Section 3A entity, but the MBOD and CCOD are directorates within the National Department of Health. The new law will provide for a proper Section 3A entity under the Public Finance Management Act, which takes into account the issue of setting up a compensation authority, which will then oversee the administrative functions, the clinical functions, the service delivery functions, and the funding, revenue collection, as well as the payments of income in terms of payments of the income protection part of the fund. And the aim is to actually move away from the government subsidy. And then it'll be the total budget, as with any other entity that's provided, as with other social protection funds or medical aid funds or health insurance schemes, etc., with lowering the inputs. And thereafter, the budget will cater for the fact of being able to use the budget appropriately, the 6 billion fund or whatever the fund will be in future, in terms of a budget process which covers the cost of administration, the cost of healthcare benefits, the cost of the medical assessments, the cost of tracking and tracing, the cost of the database, and the social protection income protection fund, as we call it. That's the payout to the claimant or the dependents of the claimant. So that's the purpose of the legislation, to take MBOD, CCOD, and the fund into one public entity. I answered the issue around the AG's report on the non-review of the financial statements. Ms. Khumalo, Honorable Khumalo, had asked about the risk determination methodology and the inputs. It has been implemented, and we're grateful that Mr. Zondi is here, the Deputy Chief Inspector of the Department of DMPR, and he chairs that committee. But I'll ask either Dr. Machali or to answer the question on the risk determination and the number of mines that have been controlled and the levy changes. Over.
Thank you, Dr. Perry and Honorable Ms. Khumalo. So the new risk determination method has been implemented as of April 2025. However, we've all agreed that the risk rating will be adjusted to 1, and for all controlled mines and works. And the average will be then monitored over a 7-year period. So, and we've started with engagements, workshops through Minerals Council, HPC, GE, environmental engineers, and through the DMPR Mine Health and Safety Council. So we've been engaging, and they're also inviting us to their tripartite meetings on a quarterly basis. So there are engagements, but we are all we've all agreed that the risk rating will be adjusted to 1. So no punitive measures for now, and we will monitor over a 7-year period. Thanks, Dr. Perry.
So we have implemented, Honorable Ms. Khumalo. On the issue of the advisory committee, we do form a quorum, although the numbers are not there. And it's not a typical governance structure. It is advisory to the commissioner. Ms. Mama, do you want to comment on the issue that it may not be fully functional and some of the difficulties we've had in recruiting members to that committee? Ms. Mama?
Yes, thank you. Thank you, Dr. Berry. So the committee do have terms of reference, and it states clearly that we only cancel the membership if the member is not sending apologies. However, in this case, the members has been sending apologies. And however, what is important is the representation, as Dr. Berry has indicated. And also some of the members during the period has resigned, and we sent the letters to the representative companies or the unions to give us names, of which sometimes it takes long for them to respond. But we are in the process of appointing the members, the new members. Thank you. Thank you, Dr. Berry.
Okay. Related to the beneficiaries, Honorable Ms. Khumalo, not knowing their rights, you're quite correct, and this has been a sad indictment of the system. And we've tried through outreach activities, working with the ex-mine worker associations, working with provincial and neighboring country governments and NGOs in the field to try and deepen that. Chiamiso Trust has done a lot in terms of reaching out to ex-mine workers and through local radio stations or other processes, but mainly to the ex-mine worker association. we've tried to reach out. Office of the Premier in the Eastern Cape and the Free State and Northwest were very active. We worked very closely with the Mpumalanga Department of Health and their Office of the Premier as well in terms of some of these activities. And we have a set process in place. And the beneficiaries, we try and reach them because you have to get to rural villages ultimately, and radio is probably the best. This partly links to the touts issue, which I'll relate to later on, which the Honourable Chair had raised about people coming to halls and collecting forms. But it's a difficult process, and going forward, we've insisted with the mining companies that on exit, the individual workers have to be told, or even while working, about their funeral benefits, their pension benefits, their social protection benefits, compensation, and if they fall under ODIMWA, how to access it, etc. In terms of the process, the medical examinations that we have to provide, etc. So we've insisted with Minerals Council, and there's a booklet that's now out, funded by Minerals Council in multiple languages, that will be given to the workers on exit and inputs. And I pointed out our special database that will be kicking in from the 1st of January, which will also have details so that we don't have this process again. Now, the key area is, unfortunately, if a claimant had not come and had a medical assessment and there's no clinical records, we've really battled, particularly within the Shiamiso Trust, of death certificates having recorded cause of death, or a clinical record in a provincial hospital. And that's something that we are looking at as well, is one of the innovative ways of closing the claims, is to try and find clinical records, particularly in provincial hospitals. We've done a proof of concept within the Eastern Cape, St. Elizabeth Hospital, as well as Free Hospital, and hopefully we might pick up something in terms of that. But the overall point is that we are trying, through outreach activities within provincial and local government as well, we've been quite involved with, to try and reach out to tell ex-mine worker beneficiaries if they've got any funds available, and through the website to make those databases available in terms of the process. So we tried, but if somebody hasn't come into the system, then unfortunately may have a benefit with the pension fund or the provident fund, but if they didn't have a clinical record, then it's very difficult. We cannot pay out on the basis of a non-clinical finding. Honorable Ms. Shabangu, you're quite right. I mean, this has been a major issue that's been going on now, well, since 2016, when the initial assessments were done by Department of Employment and Labor, and then our infrastructure unit at the Department of Health, was brought to the attention of our minister late last year. And as I said, he wrote to the Minister of Public Works and Infrastructure. He's in the process of sending a second letter to Infrastructure, Public Works and Infrastructure. We don't have any timelines, unfortunately, because of the procurement issues with DPWI. But what we've written to them in terms of the submission to our minister was, if they cannot get us an alternative building, then at least try and renovate the current building that makes it compliant with decent working conditions, as well as health and safety interventions, because we also get ex-mine workers coming to the building. So it's not just the workers, but it's also visitors and ex-mine workers that are at risk in the event of a fire or a problem in terms of that. On the fruitless and wasteful expenditure, Kert or Ms. Mama, through you, Chair, we'll talk about the fruitless and wasteful expenditure, as well as the amounts that was requested in terms of the write-offs, etc.
Thank you, Dr. Barry. Thanks, Chair. Just in terms of the debt write-offs that had to be done during the year. So firstly, the fund does have a policy in place, and we exhaust all avenues before we get to the final stage of writing off debtors. A lot of the operations, and I think you could see it in the presentation, a lot of the debts relate to a period before the cleanup started with current management. And after all our efforts were exhausted, we had to write off those debts for the fund. And then actually that leads to the Section 74 claim against the state account, or against monies appropriated by Parliament. And that relates only to the capital amount for those debt write-offs, not to to the full amounts, including estimates and interest from that period. Thanks, Chair.
The fruitless and wasteful expenditure.
In terms of the, thanks, Dr. Barry. In terms of the fruitless and wasteful expenditure, it's important to note that it is still under assessment. We had certain events during the past year, especially with cross-border payments, where we think there might be something that needs to be investigated between the banks and the local high courts in the countries. The Commissioner has led an investigation and a meeting with foreign counterparties, but we still need to investigate the matter further to ensure that this is really a fruitless and wasteful expenditure before we can reclassify it. There's also an effort to clean up the existing fruitless and wasteful expenditure that before the fund became an entity, and that investigation is being handled by the Department of Health. Thanks, Chair.
Chair, on the issues of this administration, we had to get on top of initially the payments and the revenue side, and now we are cleaning up some of the old issues related to long outstanding debt, fruitless and wasteful expenditure, and consequence management in internal terms of the department, noting that the fund itself doesn't have any employees, and anything that has to be done through the departmental loss and control office, as well as the consequence management through labor relations. And then the third aspect is related to the issues where the Hawks have been investigating certain cases. There's a case currently with the Palm Ridge court, which deals with one of the touts. Unfortunately, it took us about 4 years in terms of the process, and will hopefully conclude in January next year, we are told by the prosecutor and the investigating officers under the Hawks in terms of the process. So we are pursuing some activities in terms of the criminal justice system, and then other activities internal to the department that we need to take forward. Honorable Dr. Letlape, hopefully the sins of the past will be sorted out. We're not perfect, but hopefully the database, the dependence issue, and the preventive measures that are being put into the mining sector will be important aspects as we go forward, that firstly prevents disease, injuries, and deaths in terms of occupational related injuries and diseases. And then the issue about the databases, if you fall, unfortunately, because of any of the problems, then we do have a way of tracking and tracing, etc. So we'll keep the portfolio committee informed in terms of that, but it's due to go live. We've prepared the database. This is from funding from the Minerals Council South Africa, and it would be a substantive database. The only issue is that it will only cover the 50,000 controlled mines and works, and possibly this needs to be extended to the further 150,000. But that's a decision which has to be arrived at with DMPR and ourselves and DEL in terms of the works component. So it might be something for an inter-portfolio committee meeting as we engage through that process. Because I have legislative responsibility as the commissioner and Dr. Machali as the director for the 350,000, where we can demand this information of the register, the beneficiaries, the mine workers, etc., but not for the 150,000, which we do not control. And then, of course, we're continuing with engagements on preventive measures, lowering the dust control, the dust, hazardous dust levels, the noise levels, etc., and we're engaging overall within occupational health. Chair, you had raised the issue, and again, thanks for alerting us in terms of the positive results. I think we appreciate both the bouquets and the bats that come our way at times, but in general, it's been bouquets to us to try and make a difference in terms of social justice and redistributive justice for the people that help to build the economy of South Africa in general, but also with the migrant remittances to also neighboring countries and rural areas in terms of this. And with our compensation payouts of about 2.1 billion, we hope we've made some differences to the colleagues who actually have disease, although more needs to be done. So the IEC database is important. I'm not too sure if you can give us any suggestions on Home Affairs. It's been going on now. We tried since about 2018, and we've tried with the new so we wrote to the new minister late last year, who then put us in touch with the officials. And unfortunately, it's dragging along in terms of the memorandum of understanding between our two departments, in terms of myself as the accounting authority for the fund and the Director General of Home Affairs. But it might be something we could take offline if there can be any support from the committee, because it helps us with also the issue around debt registrations, marriage certificates, and a range of stuff, notwithstanding our work with the Department of Justice. Dr. Machali, the issue around the recruitment, I can give a general input. Salaries are the main issue because we have to stick to civil service. But Dr. Machali, the two people that came, the radiographer and nurse, and why did they leave after a few months? Dr. Machali, this was the Honorable Chair's question.
Thanks, Dr. Perry. And Honorable Chair, they were both engaged at entry level, but they were hoping that they would get additional remuneration like overtime. However, we don't do or we don't have overtime like hospitals. So yeah, it was a bit tough for them not to get additional remuneration. Thanks, Dr. Perry.
So, Chair, we don't have occupational specific dispensation that applies to clinical colleagues, in hospital services and other services, because, we're sitting mainly as an administrative entity, although we are rendering some clinical functions. So unfortunately, entry-level human resources stuck to the guns, and although we did motivate, but then the individuals left after time. These are professionals, radiographer and the clinical nurse. On the issue of the CFO, we in the process, we had to create the CFO post, and then in the process of recruitment, advertising and recruitment. It is a level 14 post, which was the highest we could go in terms of the MBOD, CCOD organogram. And we hope we'll be able to recruit a suitable candidate for the CFO position. But in the meantime, we do have very strong financial support through the Minerals Council and colleagues like Kat van der Heijden and the team funded through the Minerals Council. Chair, I think that covers us in terms of inputs that we made as best as we could to answer your committee, and do appreciate the engagement with the committee and inputs that can further the issues around how do we get to unpaid claimants, and going forward, how do we prevent these things from happening again? Chair, back to you. Over.
Thank you, Dr. Perry. I think you have managed with your team to cover us up. But in addition to the suggestions that we always make as a portfolio committee around the tracking and tracing, I am also adding up the use of social media platforms. That's another easy way, because when you have a sort of like a WhatsApp, a Facebook page where you get followed, there is an information that you can share there. And also what you partly mentioned, the radio stations, that's the most accessible means of communication more so in rural areas. So those are the additions to what we suggested in the previous years. I think you have done your best. It's good that when you are required to come and account, you are able to. These years, you must continue doing that. How we wish all those that are due to get their lump sums, their compensations from you, may get that My apologies for using the word dependent and claimant. To me, that meant something different, but I heard you when you said if a person dies before he makes the claim, and the claim validated, it's difficult for the dependents to get whatever that was supposed to be due or what was there for before. I understood you around that, but sometimes in our life, it's very difficult to identify the real and actual dependence of a person. Let me stop there, thanking you with your stakeholders for coming over. Thank you very much. We wish you the best in your work. Thank you very much, Doctor. You and your team, you are released. Thank you.
Thanks, Chair, and we wish the committee well with its deliberations. Goodbye.
Thank you. Committee members, I think we have come to the end of our interactions. Now is that time. I have to thank you for your time. We've been together since the morning. We have now exhausted ourselves. I think on the issue of announcements, I need to remind you that tomorrow we will be starting at 3 o'clock, reason being the time allocated for caucuses. Because political parties need that time to engage with their members. So by tomorrow, the planning is such that we start at 3 up until 9 o'clock in the evening. On that note, honorable members, thank you very much for your contributions. And for your availability for the meetings. Thank you very much. The meeting stands adjourned. Thank you.
Thank you.
Thank you, Chair. Bye.
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 Thank you, Chair. Goodbye.
Bye, everyone.